Echo 46 is 1041, and I notified PD.
10-4, thank you.
And get a good look at the injuries
Be
here.
advised, if you see an individual
Did you need
in
medical, sir?
red,
No, I'm here to.
in all red with the red
if
ATV, he is the one who had shot our own. Make sure you proceed with caution.
No, I'm good, bro. I'm just waiting to see what happens with this.
Anything I can do to help?
Thank you, Yogurt.
Okay.
I am having issues seeing the wounds here.
Okay.
Sorry, I had to hang up with you. One of our own just got shot outside the hospital by somebody who's been causing havoc here.
Oh. Okay.
Yeah. I can help you out real quick.
Thanks,
It's currently locked because there's a shooting at the hospital, so.
Oh, fuck.
Yeah.
Alright, let me just hop in a bit.
Alright. What happened?
Oh, I got hit by a car and knocked off my bike.
Oof.
Luckily, she wasn't going too fast, but I tumbled.
Did you feel or hear anything snap, crackle, pop like a Rice Krispie treat, or was it just more sore?
No, I'm definitely bleeding, though. My left arm scraped up pretty bad.
Okay, I can go ahead and clean that up and then see if there's any need for suturing.
No, I'm checking on the person over there.
Yeah, no worries.
Yeah.
56 is code 410876 back to pillbox.
10-4. I feel like I tried to clean your wound with saline, it just wasn't working.
Yeah.
There we go.
It's alright, thank
My
you.
saline bottle was a little, had a little hole in it. Alright, there we go. And let me see if there's any need for suturing.
Actually, I'm gonna go park the ambulance if we have people shooting us.
PD to EMS. Do you have a description of the person that shot the doctor?
Yeah, he's gonna be, in all red with a red helmet. He has, a red kind of ATV. He's claiming it's his mobility scooter. One of your officers did see him earlier and speak to him.
E8641.
Echo
Copy, thank you.
56 to officer.
There you go.
Yeah, go ahead.
That
Thank you.
gentleman at the clothing store that I just attended did mention
appreciate
that
it.
that ATV was his mobility scooter. I don't know if it's a coincidence
How you feeling?
or something to be wary of.
I'm a little sore, but I'm alright. Thank
Copy.
God.
Thank
Thank God. Alright.
You said that it was a red ATV?
A-firm.
Yeah, this is like a pinkish ATV.
Yeah, no, it was definitely red.
Copy. We'll keep an eye out.
10-4, it also had a red spoiler on the back. Yes?
Hi, the
Roger that.
person getting surgery, that was one of the doctors, is that correct?
Yeah, she's a doctor, yeah.
Can you call for
56 is
864?
23
Or
Billboard.
actually, I'll be chilling in the hospital, but if she wakes up, can you let me know and I'll talk to her?
864?
Rizzo.
Oh, it's you. Okay.
Yeah.
Alright, yeah.
Yeah, I'll chill around in the hospital for a little bit and wait.
Okay.
And if she ends
If
up
she does
going to
wake up,
sleep,
I'll
yeah,
call
yeah.
for you.
Okay.
She will not go to sleep anytime soon, so
And-
she will be fine.
Hello. Do you guys still need assistance in here?
If you want to go ahead and get the large hole out of her shoulder.
Yeah. Left or right? Okay, the one I'm at. Perfect.
Left. Perfect.
Yes, I stand just.
And I'm just going to go ahead and start with this gunshot wound here that might be lodged in the lung. Okay, it is the lower portion of the right lung.
Alright, I am checking to see if it's lodged in any bone, muscle, or any type of vessel. So I can carefully remove it.
Wait, then I started.
Still looking to see if it's lodged in any bone, muscle, or vessel. I'm just focusing on the one that's in the left arm here, specifically, to see what it is lodged in. I have done an incision to make it a little bigger and the retractors, just trying to see where exactly this bullet is located so I can see if I can safely remove it.
I do have access to her lung here. I believe the bullet might be lodged in the one here is probably lodged in her lung. I am going to try to use a magnet tool.
Closest shoulder joint
And-
just looks like muscular, so I'm gonna go ahead and remove it.
And hopefully the magnet tool is able to get the bullet out. If not, I'll have to go in with other tools.
Okay, let's see if this bullet was removed without causing further damage here. Perfect.
Right, looks like I was able to get it out with the magnet. Good. Alright, now I am going to apply a bit of biomesh graft here.
I am suturing up the damaged muscle tissue here as best as I can with dissolvables. No microsutures
And-
here.
And going to microsuture this graft over these holes for each one of them. All right. What is your name, by the way?
Mine?
Yes.
Jumbles?
We're all family, so yeah,
Uh,
you're the only one we don't know.
Jumbles, do you mind increasing the
Echo 56
airflow
is
of the
going to 76
intubation
to MRPD,
so I
giving
know?
courtesy ride to 2 PD
Basically, it will
officers.
reinflate the lung, and I can check for leak.
Okay, I have just went in and did a little cleanup and removed retractors and stitched her up. So what else would you like me to work on?
The airflow's
Um,
increased, by the way.
All right. I'm gonna check for leaks.
I know. I just want to make sure she comes out. We're fine.
Just verify that the only thing left to be treated is what I'm taking care of right now. O2 is climbing. So fairly low, but hopefully you'll get back to normal here soon. Right, you can go ahead, return intubations normal. And I'll go ahead and clean up this
Echo
area here.
56 is 76, back to Pillwatts.
Her vitals are looking somewhat stable.
Right, Nancy?
What did Nancy say? Sorry?
Who the hell shoots at Sam's, basically?
Someone who
Harry.
apparently declares wars on
I
Sam's
mean-
for no reason.
I know who it is.
Okay. Well, you can tell
Pebbles.
Rizzo that, but right now, focusing on her. Rizzo is
I
gonna
mean-
talk to Trina, though.
I had my finger cut off, my eye
5623
pulled
Pillwatts.
out, and my leg cut off by people who knew that I was EMS.
I had my liver removed while I was still conscious. By someone who knows I was EMS. I also been shot in the head by somebody who used me as a hostage. Luckily, they grazed my head, but fucking concussion and a half.
Alright, looks like everything has been patched up. Let me just verify.
It's gone good. I love Rebirth, honestly. Remove that because I don't get job calls. Alright, I think we're good on this side. Anything else? Trying to see if you missed anything.
I'm not seeing anything missed.
Are we thinking she's gonna need ICUs or calories? It's
Okay,
like
just recovery room.
Yeah.
Alright, let's go ahead, bring her into triage. And we'll do the final treatment over there, remove her from intubation and everything in there.
Gotta get her off. Innovation's not removed yet.
Echo 56 plus 1, 76 to 200 at mainline.
10-4. Bring her to a comfy bed. nice bandaging touch here. Go ahead and get her on the bed, Nancy. Alright.
Ah. Sorry. Anyway. Hi. You're just waking up, Vincent.
Echo
You're just
56
waking
plus
up,
123
Vincent.
mainline.
Just
What happened?
Yeah, I'll be a little woozy for a little bit, just while the sedation kind of leaves her body.
What's going on?
Well, you got shot. So
Ow.
you had to remove the
Can I-
bullets.
Can I have some water, please?
Get waters from these machines? No, I cannot. Oh, you're back.
Let's strikes and you strike back.
For someone
Where does
to
one get
re-kidnap
water?
me?
What?
There is the vending machine things
Okay.
right there. They're so.
I feel like the water machine should be the things to give you water, you know what I mean?
Yeah. In the little community fridge we have.
We have a mini fridge?
Yeah, these cabinets back here.
What the fuck?
Yeah. We have a bunch of food and drink.
What the fuck? Bruh. Bruh.
The more you know.
I'm an FTO here and I don't even fucking know that.
I mean,
I'm gonna cry, okay. Okay.
Oh, you okay?
I'm trying to give you water, but I think you're gonna have to stand up for me to give you the water, unfortunately.
Yeah, thank you.
Yep. You can lay back down if you'd like.
Fuck.
I'm sorry.
I wanna cry.
Okay, he's
Hi.
got through and through. He's obviously conscious and cognizant. They're in his arms.
All right, my dear, let's get you up on the bed
feel
here.
Insulted. Okay. Alrighty, hellos. Oh. Hellos.
Hello.
Hi. What we got, Dahlia?
Okay,
But
I just realized I was possibly screaming. My apologies. Okay, we
Yeah.
have 2 GSWs, one lodged in the no, sorry, we have a single GSW lodged in the arm. Patient also had some pressure on the chest from his vest, which we have removed. O2 mask was given. I have packed the bullet up as best as I could.
Let's go. Let's get you
Perfect.
can I get the good
up
shit?
there.
He's been a good boy.
Ooh woo.
I think the answer is, do you want to go back on duty after or no?
Okay. All right.
I have to.
I'll sit you up.
Then no.
Then no.
Fuck.
Yeah, I got you.
All right, I'll leave him in your hands, Era.
Okay.
What if I say
Get him back here.
no, but actually do?
And then I would go to your command and say that you are now
Get you all cleaned
not
up.
allowed to go on
Get
duty
stitched up, use
because you
some
are on stuff
antiseptic
that
as
will
well.
alter your decision making.
Fuck.
Just make sure you,
Yeah.
you try to stay safe. for at least a few hours, okay, honey?
Yeah, yeah, absolutely.
Anywho,
I'm gonna-
I'm gonna go ahead and see
Gonna security lot
how
will deal
deep
all
this
this.
is. I'm also gonna. Do you
Yes,
have
that's a
any
good
tightness in your chest right now?
No, just a little winded.
Thank you.
Let's get the gauze on here with the antiseptic on it.
What do you need?
Echo
Thank you
56 to
so
Echo
much.
50,
Thank you.
55.
Mm-hmm.
Go for it.
Are we all clear? Is that everyone?
All right, it's not that.
I believe
deep.
so. The last
I'm
two
gonna go
officers
ahead
are
and do
at
some-
the
Are you
bar.
allergic to anything, my dear?
10
bullets.
4. I'll come upstairs and take a look.
Okay, I'm gonna go ahead
Just-
and do
just
some
bullets.
lidocaine.
Thank you. Appreciate it.
Okay.
Oh my god, Brooklyn!
Gonna go ahead and do some lidocaine and I'm
Hi.
here.
What's the
Gonna
situation?
go ahead and remove the bullet with some forceps.
I'd like to reiterate my statement from yesterday, Bradford.
Being?
Please, shotgun.
So who called me Indy?
Yes, please do.
Not sure.
Who else is snooping around that area?
That's my mom's ex-girlfriend. That makes it very awkward.
Oh my god. Hi, Brooklyn. Slay Queen.
Until everybody's getting patched.
Right.
Please stand face to face. I still
Surgery.
can't put my finger on who you are.
Doing the
Who
little
is this, Harry?
stitches.
Oh, it's a 50-50 shot.
Everyone's staring at me.
Okay, it's Joshua.
Antibiotic and gauze.
Look away.
It is that, yeah.
Alrighty, how's that?
Didn't feel a thing.
Okay, especially if
Perfect.
it's
That means the lidocaine was working. So we're gonna go ahead and I am going to
Sorry.
give you a little bruise balm for the bruising around your chest. I am also going to need you to get out of the bed so I can give you a finalized
good to go.
bandaging here, unfortunately.
Right, so
That's okay.
Is there anyone else, Doctor?
Does it look like it? I think everyone else might be upstairs.
Where's
Potentially.
Bradford?
Okay, I'll head up then.
Hey, Queen, I'm in here.
Where?
In with me.
Pink shirt.
What the fuck? I didn't recognize you.
Hey, Queen.
Hey.
Alright.
Long
how's
time
that?
no
How have
see.
you been? Oh,
I've
so
been
much
very
better, thank
busy.
you.
Perfect.
Very busy getting fucked.
There's what in the room?
Yeah, by
Shooting.
Shield.
Same people?
Don't know.
Non-stop, like fucking bunny rabbit.
Who called me Indy?
Oh yeah, Astrid did. Definitely Astrid. Yep, that was Astrid.
Well, what
Yep,
did it-
not me. I did not say anything.
I didn't say anything.
I'm hurt.
Have a cold feeling on your fingers.
I don't look like Indy.
This is just.
No, I know you don't. It's just the hair, you know, the flower crown. I just
It's
like
not even
default
the
to
same
India.
flower crown.
I'll do it.
I changed the flower crown for that exact reason.
Flowers are flowers, though. No, am I wrong?
No. She has a
Good.
white flower
Thanks, me.
crown. Mine's purple for my uniform.
Lord,
I just see a flower crown, and I point that flower
And you
crown.
see
I'm sorry.
brown hair, so apparently everybody has to be Indy now.
you were shooting on.
I mean,
Sarah,
you
huh?
do.
It's my mom's ex-girlfriend that makes it very awkward.
Yeah,
Oh,
yeah,
well, that's a
uh,
lovely love story. Can't wait
yeah,
to
but
not
we
hear
have to-
about it.
We have to take like.
No, it's just when it's my mom's ex-girlfriend, everybody keeps calling me her name. It's really awkward.
Whereabouts am I going to find your ID, mate?
Yeah, I get
even
that.
I even had a talk with
Understandable.
Indy. She's like, yeah, I
Oh,
don't know why
damn.
everybody keeps doing that. I was like, I
Yeah,
don't know.
got an ID, yeah.
Crazy.
Hi, I'm Dr. Arabella Romanoff. Soon, potentially,
you haven't got your
Arabella
ID on
Rima
you. Have you
Marks.
got, like, your worker's license on you? I saw a card in.
Are you also getting adopted into the Rima?
Rima Marks
Marks.
family, yeah.
Jesus Christ, it's like a fucking plague.
I've pretty much already been considered third daughter for a while, ever since I got tortured. So,
Just gonna
Fair enough.
Take this out of your pocket a sec. I'll be back in a second. I just need to have
Is
a-
Bradford gonna make it?
Okay.
Yeah, he's perfectly fine. He's just having a chit chat.
Is he
with
dying?
her. Nah.
I feel like he's dying.
He asked for the good
He-
stuff. I said, "Do you want to stay on duty?" He said, "Yeah, I have to." I said, "Then no." And he's like, "What if I say that I am not and I still do?" I'm like, "Then I go to your command and say that you are on something that is going to change your decision making." He's like, "Fuck."
I just need to make like much of the decisions right now. I think.
It might make decisions worse.
Thank you. Yeah,
You guys
told,
Yeah, that's a good thing. We need a car, or we have to run.
gonna start from scratch.
Milton's got his car here. Milton,
guys
can you
take
take one of
care.
these two and that guy to go?
Because
right.
like I'm
gonna be
very
giving you
rusty,
this.
so...
Nice to meet you guys.
Now, but we'll
Please stay safe, guys.
Why not Indy?
I'm not
Love
Indy.
you, Bradford.
No, I said not.
Love you, Bradford.
Oh my god.
Read at that. Oh my god. Oh, hi.
Hello, sorry. Ugh. Everybody keeps calling me Indy. One of the officers said, "When did Indy become an officer?" I'm like, become a doctor. It's like, motherfucker.
You clearly look exactly like Indy. What are you talking about?
I have a different hair crown.
Doesn't matter. Look exactly like her.
I'm sorry, I have the same hairstyle.
You gotta remember,
Hair
people are
color?
face blind.
Yeah.
People are face blind.
That is true. Even though, you know, they can't really see my face, they see a mask. So to be fair, they kind of have that going for them.
Mm.
Mom, can you show me where the white gloves are, please? Please.
Take it.
Bradford
better.
tried asking, Bradford tried asking for the good stuff. I said, okay, the question is, are you gonna stay on duty after or no? He's like, yes, and I have to. I'm like, okay, then no.
Happy.
He's like, what if I say that I won't and I do?
I'm
And I
just
said, then
shy
I
of
go to your
58K,
command and I tell him
you
that you're
wanna
on
go in half
something that's
on a
gonna
house?
be affecting your decision making. He's like, fuck.
I don't have that
It's
yet.
like,
Maybe
nice
today
try.
after the wheel.
Right, I got lucky at the wheel last night. It picked me up.
All right, let me
Call me
see.
Indy, how dare. Oh. Wait, I think I just found it.
Yeah, I think they're right next to the blue gloves. It's just
These are not the right gloves. They are white, but they're not right.
fifth
There you go.
row, third.
Nope, that's not right. It's the 4th row, first one.
Okay, maybe I miscounted.
Right here.
Or maybe, I don't know.
Thank you.
But you found him.
See ya.
I did.
Sorry.
Hello.
Is it Arabella?
Arabella, yeah. Hi.
Yeah, nice to meet you. It's Nasir. I don't know if you remember me back from home.
No, I know.
How are you doing?
I'm good. How are you?
You good? Doing good. Yeah.
I
and,
may or may not have put in your little thing that you're good bean, so.
I may or may not saw that. Also. Yeah, I appreciate you. That's why.
You're welcome.
Yeah, you're good. But, you know, we have known each other for a long time, so.
I mean, you are a good bean. It's true.
Yeah, I'm. Yeah, thank you. I appreciate it coming from you.
Don't worry, I quit the other place.
Yeah, I heard something about that yesterday when I was there.
You heard what exactly? What did they start saying?
No, I just I asked Emma you know, Lina's sister.
Mm-hmm.
I asked her where, I asked her you guys because it was long time ago. So I asked about people who voted after the change, and then she said, "You, Lina, and Nora quit." I said, "Oh shit."
Yeah, they tried saying that I was acting malfeasance.
What's that mean? Sorry.
Basically, it's using stuff that you can do with your government job for ill intent.
Yeah.
I'm sorry, how? If I ever look at reports, it's to better myself or work on helping the patient, not for ill intent.
Yeah.
And they tried to accuse me of it, and I was like, no. I got tortured by a dude. They're like, yeah, you looked at his report, you said that you read his report. I said it because I misspoke. I couldn't even look at his damn name on the MDT after the fact, let alone would I be able to fucking, you know, read his damn medical record and see his name multiple times. I don't know if it would be multiple times, if it would be patient or what. I don't fucking know. I just know that I wasn't gonna fucking risk that. But they were convinced that I did, so, yeah, no. I quit and I left.
I did
If
it.
my
I
own
mean,
people are gonna do that to me, they can go fuck themselves.
yeah. I mean, I don't know how I stayed also that because I mean, it happened to me in the DUC, but when I was DUC, they suspended me for something. I don't know what happened.
And
They
the EMS did?
No, the DUC.
No?
It's basically the same thing. Basically, happened almost. They suspended me for something dumb stuff. So I said, "Fuck no, I'm also I'm leaving there." So I just stayed as EMS, but yeah, and then I left EMS because, yeah.
Yeah, so they're trying to do shit for that, so...
No, I mean, I glad that you quit. I mean, I applied for the, but I don't know if I will get a job there now anymore after, no.
No, they're trying to charge me for it, and I was like, yeah, no. No, because this is not fucking true, so I got a lawyer. I'm like, I'm fighting this. No.
By the way, did that not happen? Same thing with Lina. They charged her for murder.
Yeah.
One time.
They tried to charge her for murder because she killed someone who had just
Jesus.
tortured her.
56 is going to be
And now
Yeah.
they're
for a
trying
moment,
to charge
just
me
doing a report.
for malfeasance because, more or less, I didn't die, and I apparently
Okay,
had to
no.
have looked at something that I didn't look at, but because I misspoke, because you know me and my lack of ability to English half the time, I misspoke. And so they're using my misspeaking against me. So, yeah, so over there, I'm considered a felon until, it's found not guilty.
Oh yeah, but are you gonna return there? Because I heard Nora is not gonna go back. Her passport
To the
is gone.
medical? No.
No, to the city. I mean.
I mean, to see my friends a couple times, yes. But
Yeah. Okay.
that's about
Yeah,
all.
fair enough. Yeah. Okay. Yeah, because what's it called? I heard Nora is they took her passport.
I don't know. I'm removing their ability to see my stuff, and I'm going to call it that. Call it there, because I gave them
Okay.
my my nutrition thing, right? I'm going to remove their access and create a copy of my own report and delete that one, so that they cannot access it, because that's my documents.
Wait, I'm really sorry I didn't fly in very much. That you know, the months been, you know, with the house and everything. That
It's okay. I
Well,
mean,
you-
over there.
yeah, I saw you
over
removed
there.
my
If I'm
keys
considered
over
a
there.
felon over there, they can go fuck themselves either way because it's all
Yeah.
falsely accusing me of something that they have no ability to prove. Like, how are you
Yeah.
to know what's in my brain? If I didn't say anything about this to anybody else, and how are you to know what is in my brain.
Exactly. Yeah, I know.
Yeah, well, I'm not a felon here because I'm literally the least capable of acting in ill intent and crime.
I mean, true. I'm you're a good doctor also. When I worked here, but yeah.
Yeah, don't tell other people
yeah.
that that's what happened though, because I'm not really saying that to anybody.
Okay, no
like,
worries.
Lena knows, Nora knows, and you know now. But that's all who need to know.
Okay, yeah, no worries. I'm happy that you told me and you trusted me, but yeah, I'm not gonna tell them.
Yeah, because, you know, they're trying to fucking charge me with something and make me a felon, and...
Yeah,
it's bullshit.
the fire. I'm
Instead
not
of
gonna
having a
tell them.
conversation with me, they didn't even interrogate me. They're just like, yeah, this is a charge. We're not going to send you up to prison because you've been down here for a while, but, like, we'll have to postpone our interrogation. I'm like, excuse me?
Okay.
Excuse me?
Yeah, I hope you.
I mean, good thing I didn't have to go up to prison because I would have been up there with the person who fucking tortured me twice.
Fucking hell no.
Yeah.
I would definitely not like it, you know? If that.
There is no one in hospital that needs help, so maybe someone surrounding the hospital somewhere nearby.
Echo 50 is coming 42. Good night, guys.
Have a good one. Thank you for the help.
Oh, it's right outside. It's gonna be upper pillbox, by the stairs. Hello.
By the way, I want to preface, everyone did fantastic to do that mass cache. Thank you very much. Appreciate you all.
I'm gonna go
It's
get
also
Gurney.
not a preface if it comes afterwards, but I'm also very foreign. You whatever.
Crumbles.
Yeah.
Can you go get a gurney? Go inside, run, and get a gurney. Run! Holy fuck. Okay, I'm gonna go ahead and check for vitals. Her vitals in general. What I can, you know, her heart rate. Stuff I can check.
Yes, Tasha, I do remember what happened last time. Why you gotta wreck my flow?
So we can get her in. I just want to make sure she's still, like, got a heart rate. She's still breathing.
That's how I know. He's not cheating anymore, okay?
Okay. Okay, we're gonna get her inside, and then I'm gonna hook her up onto some vitals monitors and see what we're looking at.
Okay.
And then try and get a better grasp of what we're looking at here. Bring her on the gurney. Alright. What the hell? That was not a drop. Would you like to join me? God damn it. Mother needs to pay attention. Let's do this real quick so we can... There you are. Hi. She was found unconscious on the side of the building by the stairs. Go ahead and get her back in the bed. No signs of physical injury. So her heart rate seemed fine, breathing seems fine, so I'm gonna go ahead and hook her up to some monitors here, see what if we have any abnormalities in maybe blood pressure. If there's any visible indications.
Echo 56 is going 1042. Does anyone need anything from me before I do? Your heart. Oh.
Negative, thank you for all your hard work.
Appreciate you. Thank you very much.
Love you, thank you for your service.
10-5, have a good night. Thank you for your service.
Keep up the craziness.
Always. Alright. Shivering a little bit. Good. See if maybe your skin is clammy, pale. Other vitals seem fine. Do one of you guys want to check her glucose? She's turning a bit pale, clammy.
I just want to tell everybody,
Checking that now.
you all did fantastic on that mass casualty. That was incredibly organized. It was well maintained. Great job.
Thanks, Mom.
We were well trained.
Thanks, Grandma. Wait, what are we looking at here? Glucose.
Yeah. Checking that now. .9.
The fuck? What the hell is MMOL?
Not sure.
What do you have your glucose sensor set at? I know milligrams per DL.
It's millimole. Using the UK measurement. Millimoles per liter.
Okay, let me just convert this real quick. Okay, so her glucose is low, because between 4 to 8 is healthy, so she has low glucose. So do me a favor, give her some glucose, please. Glucose, please. Please. And this one needs to eat.
Yeah, I was about to say, in
Yes,
other words, she did
glucose
not eat.
Let's put it on the roof of her mouth. Under her tongue. Ends. Prefer it under the tongue because it'll dissolve faster.
Alright, putting it under tongue. That's sorted.
I'll give her a little bit of time. Also, I believe this is Willow.
You want me to double check?
I'll double check.
Yeah, it's Willow, unfortunately.
Yeah. I remember her and Alex having a little conversation a couple of days ago. Although, do you remember Willow being diabetic at all, or did she just not eat?
No, I don't think. She had other issues, but not diabetic.
Hi, Willow. Gonna back away, give her a little bit of space as she wakes up, because her waking up in a different place is gonna freak her out. Hi, Willow. Okay. We had to give you some glucose because your glucose levels were really low. You didn't eat.
Miss Ma'am,
Willow,
you
quick question.
need to eat.
Are you diabetic at all? Or is it just you're forgetting to eat?
I don't think so.
Okay.
But then again, with the fucking shit that I was being fed in the prison, I'm not sure.
To be fair, the shit that you were fed in the prison was very salty.
A lot of preservatives and
It wasn't healthy for
Not
some
really
reason.
healthy.
Adverse diabetic. God damn it, Alex.
Oh my god.
Our timing of calling me is the worst. So what we're gonna do, well, if I can get off of you, what we're gonna do is I'm gonna give you mac and cheese, strawberry milkshake, and apple juice.
Yeah, Alex is in
Echo 55, 10-8.
Langley,
Yes.
right?
Did I give that to you?
You
Willow?
gave that to me.
Okay, give that back.
I blame you.
Blame me.
Alex is in Langley, right?
What did I do?
Yes, my girlfriend.
You gave me a reason to come here.
Oh, did I? Okay.
Give it back.
And look at that hot
That did not go to me.
air.
Please, yeah. Well, thank you. Thank you.
Did you get that, Willow?
Yeah.
I love her flowers in her hair, though.
Put it on the
Did
ground
any
because
of
it won't
you
let me
guys
give
get
it to
apple
you.
juice?
No, I just
I
put
did
it
not
on
get
the
apple
ground.
juice, actually.
Okay, it's on the ground.
Oh.
Apple juice belongs to the devil.
Excuse me?
Oh, brilliant.
That's a hard stance on apple juice.
It belongs to the devil.
That's
no,
a hard
it does
stance.
not. It's an insult to apple juice. Willa, I'm gonna go ahead and give you some apple juice and strawberry milkshake and mac and cheese.
Okay.
If you can come closer, please, in front of me, because it's a little funky. There you go. If you need to eat, go ahead and eat. Otherwise, I'm gonna give you my number. If you ever need something to eat, you let me know.
I'm being threatened.
You're being threatened?
Mm-hmm.
By who?
Alex.
Why?
I texted her saying, "Hi, I'm more important," and she said, "You better have a very good explanation."
From now on, if you are going to be waking up, don't call me immediately because you keep calling me in the middle of me talking to patients and I can't hear them.
Oh, I'm sorry.
This is
I
the
just
second time you've done that.
I had a missed call. It.
And don't call back, text back. And wait for me to call you.
I'm sorry.
Mm-hmm.
Okay, I'll do that from now on.
Okay, thank you.
Yep.
Willow? What you looking at?
Oh no.
What are you looking at? You can't go in there.
I know.
You like the MRI machines?
Echo 55 plus 1, 76 to the latest 200.
No.
10-4.
I'm going on duty, so I'll be around.
I don't know.
All right.
Name's Lawson.
She said that apple juice belongs to the devil, and now I'm insulted.
What?
Is that a whole
What?
haze?
The girl
What?
in the red hair. She said apple juice belongs to the devil.
I thought that was grapefruit juice.
Your grapefruit juice is fucking disgusting.
Have a good day. Red Stars, Stars and Birdie.
She literally was like, "Oh, I love her flowers," and then I said I was giving apple juice to somebody. She's like, "Apple juice is the juice for the belongs to the devil," and I was like, okay.
For legal purposes.
No, you
Feel ice pack.
Double negative?
Use a double hand.
I'm not sure if it was official.
There you goes.
Hypothetical. Is it
Arabella, did either of you discharge O'Hare from the
It's like saying, not.
ICU?
No.
Yeah, I will
Okay.
not
He's
not
looking
fix
to be
you.
discharged.
Yeah.
Linguistics
Oh,
are hard.
has
I'm
he,
very
or are
foreign.
we willing to?
He's asking to be discharged. He wants
Oh,
to
I
be
thought you said have we, and I was like, no.
Well, I was saying have because he said I was trying to confirm if that had been done yet.
Hello.
Hello.
You were trying to get discharged?
Yeah, I just woke up in the ICU now from a shooting earlier today, and I was trying to see if I
Come
can get
with
the
me.
call.
We'll go back to the room and give you a checkup. You have 2 sets of handcuffs.
I do.
Too bad they ain't pink.
Right? Need to get like the pink fuzzy ones, honestly.
I didn't say that much, but you know, if my girlfriend could have him, then yeah.
That's where I'm with it. They're
Which
way
one's
more
your room?
comfortable though. Yeah, this one over there, I think.
Yeah, no, if my girlfriend could have him, she probably would have her hands on him in a minute.
Right.
You probably know her, Alex Langley.
I don't think I've met her, no.
Oh, she's one of the cops.
Gotcha.
Go ahead and sit on the bed if you'd like. I'm gonna do a vitals check and check over your... Excuse me, hiccups. Do a vitals check and
Feels
check over your
very
bandages.
occupied at the moment. Just have a little seat.
And what did you say your name was?
Harry O'Hare.
Okay, looks like you had GSW to the shoulder. I'm gonna look over those vitals again. I wasn't paying attention. I was paying attention to the report. Sorry. Okay, your vitals are looking stable. What is your pain level?
About a 2 out of 10 maybe.
2? Perfect. And do me a favor, I'm gonna have you point forward. Or this way. Point up. Do you have any pain in your mobility there?
I'm just all stiff, honestly.
A little stiff? Okay. Well, with that being said, because you still have a little stiffness, I would say take it easy, light duty for now. Give it a day or two. And we'll go ahead and honestly just give it a day or two. If it's still stiff, take a little more time. If it's not still stiff by the end of that, then I don't care if you come back. Just please take it easy. Don't pop any overstitching, so no shooting a gun unless you absolutely have to.
Okay.
I'm not gonna tell you no, don't shoot a gun if somebody's shooting at you, because that's dumb as fuck. But like,
Yeah, no, for sure.
if somebody's shooting at you, fucking shoot back and come back to get your stitches checked.
Yeah, no, I'll take it a little bit later and then keep a regular check on it.
Alright. Well, with that, I am also we're gonna remove this bandage and see if there's any signs of infection. Alrighty. Well, I'm gonna do fresh antibiotic and bandages, and then we'll go ahead and get you discharged.
Echo 49 plus 176, the latest 200, just outside the casino.
Okay, you're all good to be discharged.
Perfect. Okay. So take it easy. You said in a couple of days, if it's still stiff, I'll come back and have a look at it.
Yeah, 100%.
Amazing. Okay.
If it's not still stiff, there's no need to point. There's no point in coming back. That's the words.
Alright. I think you got a spider.
Go 5 back.
It's been a while since I've had a spider.
1 on patrol.
And bye.
I'm looking for Harry O'Hare. He came in today. He's in ICU.
Yeah, he's leaving.
Oh, he's
He'll
leaving?
be up here in a second.
Oh. Is he in his room?
He should be coming up to the front here in a second.
Okay, perfect. Perfect.
There he is.
There you go. You fucked up. Let's go.
He's in the recovery room right now.
Okay.
Okay, I just clocked on duty, so I'll figure out what's going on. I don't even. Hold on. Oh, hold on. I'll be there in a second. I need more bandages.
Echo 56 is going 1042.
10-4, Echo. Echo 46 is 1041. I almost tried to grab 185 bandages. I is here. Apparently, I'm supposed to help figure something out, so I don't know. I'm just here. I just clocked on duty.
So do you know what happened that brought you here to football?
Yeah, I was on my motorcycle on I crashed.
Do you know what you hit? That caused you to crash, or?
Yeah, I swerved out of the way for the locals, and I hit a wall to someone's yard.
Okay. Can you tell me what your name is?
Yeah, Cruz.
Right, Cruz. Do you know what day it is?
It's Taco Tuesday.
All right. And how many fingers do I have up?
You have 3, but it looks like one finger's large, like a large finger. Well, actually, no. It looks like all of your fingers look larger, almost like they're 2.
Okay.
Like width-wise?
Like you know, like the Matrix, where like they do the slow
No.
motion.
I don't.
So vision kind of blurry. In a
Yeah, a
way.
little.
I'm just going to check your eye dilation. I'm going to shine a small light near your eyes. Just want to make sure that your eyes are reacting as they should, or okay. I think you might have a mild concussion. Would you want to get an MRI done to make sure that is the case, or?
Yeah.
All right. Right, go ahead and follow us. Oh.
Thank you, Tim.
Of course.
Oh, hello. I didn't realize that was you.
Who?
Emery.
Mm-hmm.
Oh.
That's me.
Hello, Kia.
Hello.
They got the fold arms stare down going on.
Right. Do you have any medals on you that we need to take off before we take you into the MRI?
No, and my glasses are plastic, so.
Mm-hmm. Go ahead and lay up on the bed there. And we'll get an MRI done.
You can go ahead and reposition yourself on the bed if you would like. I know it's so funky. The local doctor likes to play with people. It's a April Fool's joke, way past April Fool's.
Yeah.
You gonna resituate yourself so we can actually put your full body through the MRI?
Hold on.
I'll be right back.
Perfect. Alright, Javi, you know the drill. Can you still hear me?
Yeah, I can hear
Okay.
you.
You know the drill. It's gonna be loud. You have the little earmuffs there that you can use to plug your ears up. You can listen to the music. And go ahead and start this MRI, okay?
Echo 30 is code for the 200. Patient treated on scene, 1019.
Alright, powering down the machine. Look at this, see if I can see any results of the MRI here. Sorry. Sorry, I'm still looking at these results here. See if I'm seeing moderate. I'm seeing some swelling here. Minor, moderate, or severe is what I'm trying to figure out here. I'm not seeing any brain bleeds as far as I can tell. Definitely some signs of concussion though.
Yeah, it definitely looks like you shouldn't take that many more blows to the head at all.
Minor to moderate.
Nope. I
Moderate
do
to
see a minor bleed. There's a moderate concussion and there's a minor bleed. We'll need to take care of that hemorrhage.
So we do see a bleed then.
Mm-hmm.
Alright, I'll be your hands. I am not leading this.
Just getting a double check out what location, front, back, left, right side, up. Right. Let's go ahead, get him in for surgery. I mean, are you okay with having surgery? You do have a minor bleed in your head, so we should take care of it.
How serious is this surgery?
Very minor surgery. I actually done one earlier today. And
And it's
done
safer to have the
this.
surgery because you're not bleeding
Mhm.
internally with the surgery, you know? The more you bleed in your brain, the more likely you're gonna have further issues.
And I'm also a neurosurgeon, so.
That too. And I'm a neurosurgeon in training.
Oh, that's great that you're both doctors. That's awesome.
Yep. I am, I guess I never introduced myself. I'm Dr. Lena Rima Marks.
And I'm Dr. Arabella Romanoff. Potentially soon Lena's last name there. I just can't pronounce it right now.
Alright, you wanna
Yeah, so to engage.
you wanna
Daughter.
come this way
Oh.
and
Wow.
Yeah, she's married to Nora, who's an EMS here.
Okay.
a lot of doctors in the family, well, a lot of medical staff in the family.
Yeah, my brother was a doctor once.
Let's bring you in over here. Alright, go ahead, lay up on this bed here. And what did you say your name was? Again? Cruz?
Tavi Cruz. Javi. I feel like this is sideways. I feel like the local doctors like to play tricks on you.
Do you know if you
I feel
have?
like I'm late. I can see.
Yeah, I
do
think
you,
the local doctors are liking to play tricks on you today.
do you know if you have any allergies to any medications? By the way.
No.
All right.
You're gonna have a lot of fun with that. Just try to lay on the bed again. If that doesn't work, just, pass out 3. There you go. As I said, local docs here are liking to play tricks on you.
Mind putting the O2 and monitors on while I get the IV started with the medications? No. Just that. I'm going to inject you with some propofol, so you'll be unconscious during this. Can you go ahead? It's anesthesia. Milk of anesthesia.
I don't
Mine's
know
going.
why. I think that the word
Forbidden
monotone.
milk.
Mine counting down from 10 for me. Usually people fall asleep around 7 or 8.
Okay. 10, 9, monotone. That's on the funny word, monotone. You ever try to say monotone?
Well, we will be using mannitol on him later. All right. So basically, this bleed is on the back end of the frontal lobe, next to the temporal lobe.
Okay. I can help provide suction. Give tools as needed.
Just go ahead and get a small patch of hair shaved right here, just so we have better access to it.
Sorry, Javi.
Hmm?
I didn't give Javi a fair warning that we were gonna shave his head. Even a small patch is still a patch. Kind of a little bald spot for a little
True.
bit.
And of course, with it being a minor bleed, I'm just going to use an MBCA, which is, brain glue.
Okay, did you put Nimbex in, or would you like me to?
What did you say?
Did you put any Nimbex in, or do you want me to? I see him twitching a little bit, and you want him paralyzed while we're doing this.
Yeah, go ahead and give him a little bit of Nimbex. He is a twitcher, so
Yep. Nimbex is
right.
applied.
Mind hand me the drill?
Oops.
And go ahead, drill. You know the drill. Irrigate suction while I'm drilling.
Uh-huh. You know the drill of the drill.
Mm-hmm.
PDD EMS.
Gonna give you
Send it.
that drill back here.
I got a guy who got slapped
And-
upside the head down here with a crowbar in the 95 room. If you guys could spare a person. Oh, he passed out now.
Are you at MRPD?
No, we are in Pillbox. We're in the 95 room in Pillbox. Or like the 95
And
room.
on Samsung.
Okay.
Accurately.
3076.
I hate whenever I'm in surgery and all of a sudden talking over the radio happens.
Right? Wish one of the radios was labeled surgery.
I mean, in the SOPs, SAMS 3 is. But, yeah.
Yeah, but everybody's in SAMS 3 and none of them are doing surgery.
Right now, I'm going to look around here for the bleed. I have a general idea from the MRI, but need a more direct, precise location now. All right, there it is. Go ahead and put this MBCA here. Oh, I just noticed there's a slight fracture in his skull here. We can put some bone cement on there to kind of take care of that. Guess we are putting a peak plates on here as well. Right, go ahead, irrigate suction again for me. And while you're doing that, I wanted to grab the plate. Right. Go ahead and cover this crack up with bone cement. Of course, that tracks with this injury. With the looks of it, didn't look like it was all of a sudden, you know. All right, let's drill holes for the screws. The screws in the hole. Gonna make sure the peak is perfectly on there. All right, now let's get out of his head. Get the site closed up. Some antibiotic ointment and a gauze pad over the sutures here. Nancy, what would your opinion be on putting him in ICU? Yeah, gonna push erythromycin. So you think as soon as he wakes up, he's going to walk out of the ICU anyway?
You're gonna be stubborn. Surgery is a pretty big thing.
Yeah. I have seen patients like this before. Right.
Mm-hmm. Mm-hmm. I had too many people force me to stay.
I wasn't actually talking about you this time. All right, let's go ahead, take the monitors and O2 off them. It will reverse the anesthesia in the recovery room.
Yeah, yeah.
All done?
All done.
Can I use the cloakroom? The
What? No.
got changed?
No.
I pretend I didn't almost get smacked by Dr. Bill. Holly might need to take a nap. Or you moved him because he was still in the bed. Oh God. Try to get on the bed again? Or try to get off of it. Oops, that's awkward. Making sure it's still useful. Alright, now get off the bed. See if you can move. Okay, perfect. We gotta make sure that Nurse Nancy like takes people off the bed before we move them because it'll break the bed
okay.
and break them.
I'm gonna go ahead and start getting the report written if you want to reverse the
Reverse the
anesthesia.
propofol, yeah, and the Nimbix.
Was he brought in by EMS?
I don't know. Local doctor, was he brought in by EMS? Was he brought in by Emory? Or was he a walk-in? He was a walk-in.
Okay.
Alright, shouldn't take him too long to wake up.
Alright.
I'll test the other one once they come out of surgery.
Oh, was I not supposed to lie in this bed?
No, you are perfectly fine.
Can you guys
Oh,
get
hey.
into the beds?
Yeah. Real quickly, I need to also test this one for GSR.
Yeah, I'll give you so much to it, bro.
Thank you. I'm gonna head over here. Just
Okay.
not my luck. I'll end up somehow in cuffs.
I am going to double check
Yep.
that gunshot wound.
Alrighty. Let's get him out and back in the bed here, Nancy.
If we could get him to stand up really quickly, I need to test him for GSR.
We couldn't wait till after I'm off.
Nancy, let's get him back in the bed now.
Seriously. Go ahead.
Okay,
You-
yep, he's positive.
Yes.
Okay. I will get him cuffed back to the bed. All right.
Just let me die so you can get your GSR. Idiot.
Right. Do a scan here. I'm gonna step back. Scans. Alright, scan is off. Let's check and see how bad this break is. Or potential break. See if cement, bone cement, or just need to splint it in. Okay. Alright, so it doesn't look too bad. I would just... Are you conscious with me, sir?
Yeah.
Hi. Okay, so your injury isn't too bad. I am gonna keep you in a sling for a little bit to heal you, keep you healed up. I will let them know you're gonna be in a sling for a little bit. There's a way that they can cuff you and still, did you get shot? Or...
No,
What happened with you then?
I fell off a bike.
Oof. Okay. Anything else hurting you, my dear? This is just your collarbone here.
No, ma'am.
Okay, I'm gonna go ahead and give you a little of an ice pack as well on top of it. I'm gonna go ahead and get you sitting up out of the bed real quick so I can give this band. And you are cuffed to the bed, so we'll have to have them get you uncuffed from the bed, okay? Looks like you weren't gonna need any surgery.
Thank you.
Does that feel any better?
Yeah, I feel a lot better, thank you.
You have any irritations in your arms, spine, or anything right now?
No, ma'am.
Okay. Give me a second, I'm gonna have them...
No way.
Compounding.
He
I wasn't. I
is
just
gonna
want
be
always
in a
like to double
sling
check, you
for
know.
a little bit, so...
Yeah. No, I promise
Okay,
you it
well,
is not
then I
directed at
will
you.
secure
In
his
fact, I
cuffs.
actually wanted to talk to you and make sure you knew that it was not directed at you.
Oh,
just-
yeah. Well, that's why I figured I would just ask you because I couldn't figure out the angle from where it was at, and I do like to. Instead of
it's like this, right?
questioning.
I also think we need to talk about that because
Are you gonna need me to do a medical report for you?
I don't think that's a good policy.
Echo 69's back 10-8.
No, it should be good.
Okay.
Hey, Nevi, it's me, Becky, and they can hear me talking at a traffic stop or at a stoplight. They now know that Nevi's on duty.
Brad, dude, shut
Whereas-
up. No one cares.
No one's
No one cares.
Right, bitch.
Go 46 back to Nate.
10-4.
Hello.
Hello.
Are those people okay that came in downstairs?
Yep.
Echo 74, you want to 76 at latest 200?
Yeah, 10-4. Alright, see you later.
You have a good one.
I don't think you can.
Hellos.
Hello.
How can I help you?
I got run over by a car.
Got run over by a car? Okay. Would you like me to help you to the back, or do you think you can follow me?
I'm bleeding pretty badly right now. I might pass out.
Okay, so help you then?
Yes, please.
Alright, I'm gonna go ahead and help you out then.
74, 76 to the latest, 200.
10-4.
Oh, there she goes.
Just ignore me. I'm her agent.
Okay, I'm gonna need you to back up a little bit when I do the treatment, just so you know. It's not like this is a precursor.
Oh,
What do you mean, agent?
she wanted
okay,
me
can you
to.
back up, please?
I just wanted to tell you that she's oh my god, I forgot. She's allergic to warfarin. She can't have warfarin. She has like a
Good
blood
thing I'm
clotting
not
disorder.
gonna give her warfarin. She has a clotting disorder.
Or it's the other way around. I
So
can't
it's-
remember right now.
She's allergic
literally
to
told me
warfarin,
10
or she's
seconds
on
ago.
warfarin?
Oh god. Okay, hold on.
Clotting disorder, so she's on warfarin, or she's allergic to warfarin and has a
I'm a
clotting
bad
disorder?
friend.
I'm so confused.
No, you can't give her TXA.
Well,
Does that make sense?
Good thing I don't really give TXA unless somebody is extremely bleeding out on me. So you're good.
Perfect. Yeah, she'll bleed out. Yeah, that's what yep, there you go. Yep.
She'll bleed out from TXA?
Oh man, I don't. I should have wrote this down.
Yeah, you probably should, because
Yeah,
TXA
I'm
is
a
a
bad
blood
friend.
clotting thing. It's meant to clot your blood so that we can, yeah. Anyway, I'm
don't-
gonna have her lay on the bed so I can take a better look at her gash here.
Okay.
I need her to lay on the bed, and then I'm gonna look at that medical bracelet as well. Okay, go ahead and go look over her injuries and look over this medical bracelet, see what this medical bracelet says. Does she have a name?
Yeah, this is
74 is
her
code
name's
4.
Natalie.
76 to pillbox. No extra medical needed.
10-4.
I'm gonna have to look over that again because it's so fucking quick. I hate how fast it is for me to look at these injuries. Alright, so I see the gash on the lower left leg debris as well. I'm gonna go ahead and clean that up. This heavy bleeding, I'm gonna see if it looks arterial or not. If it looks arterial, I'm gonna go ahead and start a tourniquet. Alright, now, what does that medical bracelet say? I'm also gonna clean an area on her arm and give her an IV.
Say that again?
I'm not talking to you.
Oh, my bad. My bad. I'll be quiet. My bad.
There's still a lot of things I would do from a mother.
Alright, looking over this medical bracelet.
Echo 74, are you heading up to the medical on Milton?
Negative, I'm on the phone with someone at the moment trying to figure out their location.
10-4, then I will 76 at latest 200.
Okay, so basically she's A positive. Yeah, so the warfarin that you're talking about, she's on warfarin.
Oh, damn. Okay. Okay. See, you're way better at this than I am.
I mean, it says it on her bracelet.
I feel bad. I feel bad, okay? I'm sorry. I'm a shitty person. Can't remember things or that. Thank you for your help, by the way.
Alright, I'm cleaning off the leg, seeing if this debris, if any of the debris is embedded, and if I need to remove it surgically. Oh, now I'm very curious about this TXA thing because the bracelet said nothing about TXA. And usually it's best not to use TXA when somebody's on warfarin because warfarin is a blood thinner. And TXA clots your blood, but
Yes, that's...
in times it might be needed in certain situations, but I mean, from what I'm seeing, it's because of the warfarin, the blood thinner, she's gonna bleed more than normal. Just more stitching her up, making sure she doesn't pop any stitches, and making sure she gets enough blood in her. Alright, I applied some local anesthetic just in case if she wakes up, and then some stitches.
They literally told me like 3 months ago and then told me again today, and my memory is like right as we were walking in and I messed it up. My bad.
There we go. She does have a blood bag.
Uh.
Hello. Hi, what's your last name?
Hello. Carson Hunter.
How do you spell your name? Your first name.
Nathalie with an H after the T.
Nathalie. Okay. Are you okay if I add in the whole warfarin and codeine into your medical record? Because you don't have anything in there.
Yeah, I apologize. I wasn't expecting to pass out on my way here.
Okay, do you have any ice contacts you want to add, by the way?
Not at the moment.
Okay, and would you like to be an organ donor?
Sure, why not? If they work by the time.
I added your allergy to codeine, the whole stroke risk, and then on warfarin 2 milligrams a day. There you go.
Yeah.
Anything else you can think of that would need to be added?
Warfarin and stroke protocol are due to 3 previous strokes. Right now I don't remember the dates, I'm sorry.
It's okay. You being on stroke risk, it's more we know, you know, what to look for with you, mainly.
Damn, the room is spinning.
The room is spinning.
Yes, slightly. I didn't realize I was losing that much blood.
Yeah, you're currently on a blood bag. I'd say just kind of rest here for a little bit, let that blood go through your system, and then slowly make your way up. First by sitting up for like a minute, maybe 2, and see how you're feeling then, and then you can slowly, you know.
Of course, ma'am.
Now, if you do have any further issues, you make your way back here. I'm just gonna go check up on the front, and I'll come check back up on you if you're still here.
Of course, thank you.
You're welcome.
Thank you, Doc.
Yeah, no problem.
Oh look, you're alive.
Go 74 is back 10-8.
10-4, Echo 6976 down to Forum. The latest ambulance call.
And 5. Reference latest text line call.
10-4, I saw that. Echo 69's back tonight.
Hello.
Can I get an ice pack? I got bumped into by a car and my leg is bruised now.
Okay, if you'll come back with me, we can go ahead and get you taken care of.
Okay. Bubbles, come to the recovery room. We have a documentary here.
Hi, Phoenix.
Another card to the pile.
We
Another
are at
alley.
the hospital and come to the back. I have a doctor lady here to help. Hi.
Hello. I can go ahead and give you that ice pack.
Echo 74 is going to 76 to the latest.
10-4, thank you. Echo
Thank
69
you.
is actually gotta go 42 for the night.
You're
You guys be safe.
Confirmed. Thank you for your service.
10-4, have a good night.
Okay, thank you.
Oh,
Hello.
need a nice pack. I hit my funny bone.
200 on Elgin is hot.
Yeah, it wasn't too
Worst
funny.
one. Right?
Unsure of the exact situation, but shots were heard in that direction.
Hey, firm, I'll stage about 2
Whoa,
blocks away.
whoa!
Let me
What the
know.
nurse do to you?
He threw me right
Thank
on
you.
top of her and the other patient.
Damn, it's
Yeah,
crazy.
man.
Oh, damn. Nancy!
Man, those are some sick dreads, bro.
Bruh, Nancy.
Hell yeah, dog.
Stop
God.
throwing
you too, bruh.
patients on top of patients. We've talked about this.
Yeah, Nancy being a bitch lately, man.
How you doing, girlie?
Doing a bit better now. Thank you.
You're welcome. Do you need anything else before I, get out of...
Well, I mean, if you would so kindly take the IV out, otherwise I'll just do it myself.
Well, I mean, Nurse Nancy usually does, but I can go ahead and do that too.
Which brings me to a valid question. Can I ask you a question, Madam Doctor?
When I'm done with this, because my focus
Oh, yeah.
is on this.
Will do.
He likes multitasking.
Have a good one, man.
You too, bud.
You too.
Be safe.
Disciples rule, bro.
Of the rock band.
Here you go. Alright.
Thank you very much, man.
Usually I can multitask, but today I'm just kind of... bleh.
Hello, I'm annoying Tom. How are you?
Not gonna call you that.
Okay, cool. So we have a question.
Just call him Jax.
Yeah, we
He'll
have
be
a
fine.
question. It traveled all the way to your beautiful hospital to ask you, how do you? Because it seems that like your staff is the same or maybe included in this. Is the ambulance people included with you, or are they different people?
Mm-hmm.
Okay.
Why?
How does one try to work for the paramedic EMTs?
You express interest, we get your phone number, your name, and we have somebody reach out to you.
Hi, my name's Tom.
You show me your ID.
Nice to meet you. I'll be 100% honest with you. When I do my job, I'm way better at remembering medications. He's just nerve-wracking me.
Can you share
Yeah.
me? Can you share me your ID?
Yeah, I'll try. That work?
Nope. Come here.
Why? No. I'm gonna hurt myself.
There you
Oh,
go.
boom.
That's...
Oh my god, I
Please
feel like
don't
a
hurt
cop when I
yourself
do that.
taking out an ID.
Yeah, I'd be more concerned if you're hurting yourself taking an ID out.
Did I mess up?
It's okay. He's usually competent. I can certify for that.
All right, and do me a favor.
Just
and
because
share
you're
me
way
your
better
phone
than
number.
me.
EMS from PD, you guys are clear for roll in on that latest 13A.
Okay. Ooh.
You want me to share my phone with you?
Share me your phone number so I can put your phone number here.
Boom.
Thank you.
What a cool name. Arabella, is that your name?
We need doctors right now.
Oh.
Or is there only
Okay.
one?
There's only me.
Okay, well, take your time. When you're ready, we need your help.
We'll hang out for a bit. I'll give you my information after.
I
If
don't
you just
wanna
want to
put-
send me your phone number real quick, I have his, and you just want an EMS, right?
For now, yeah.
Okay. We can
Yeah.
always talk about cross training in the future. Cross
She's
training is
done.
very acceptable here.
She's done
That's
everything.
great.
She's amazing. I just drive the wee woo bus for a very, very long time.
Shush.
Oh, sorry.
Brain is not computing things.
All right. Did you get that, miss?
Yes. Yes, we.
Oh, well.
Damn.
Amazing.
And you did say EMS.
Yes.
Alright, now I can officially introduce myself. Hi, I am Senior Dr. Arabella Romanoff. Nice to meet you guys. I've kind of not been around for a couple days because I've been kind of not feeling the best, but I'm getting there. Your guys'
Well, nice to meet you,
will
miss.
receive a text when we have somebody available.
Okay,
For sure.
I'm getting hailed, so.
4 years.
Oh, Jesus. Criminy. Hello, can you put the bat away, please?
No,
we need him sure, he's gonna run away.
Well, okay, let me explain the situation, okay?
Get, Dex,
that man
get
is
in
a
there. Get in. Get into the
So,
room.
Gun down. No gun.
Get
no
in.
gun.
Get
no
in.
gun.
Oh my God,
No
please
gun.
help me. They're trying to shoot
Put
me.
the gun down.
He's a
now.
vampire.
Call the
He's
cops.
a vampire.
I'm begging
I
you.
do not care.
I
Put
haven't
the
done
fucking
anything
gun
wrong.
down now.
Put the gun
This
down,
is my
please.
hospital. Gun down.
It's mine.
Thank
but
you.
whatever.
A bat, I don't care, but a gun is a no-go.
Yeah.
Dex, get in the room. We
Get
need
in
him
the room.
sure.
Prefer not a knife either. I said
Get
a
in
bat.
the room.
Hey.
Get in, Dex.
Get in the
Doc,
room
help
just
me
so
out
we can
here.
fucking just get in the room so I can
Get
deal
in.
with this, please.
Don't let him touch you, okay? He's gonna
Don't
try
let
to
him.
bite you.
He's a fucking vampire.
All
Don't let
right.
him touch you.
What the fuck is going on?
He's a vampire, and we need you to cure him.
I can't hear.
Well, then you're gonna die trying. So
I am not gonna die trying, sir. I
let
can't
me
cure
rephrase
a
that.
vampire.
Let me rephrase that. You're going to try your hardest.
I literally can't do anything for a vampire. I am telling you this now.
Okay. Well, prove it.
There's literally nothing I can do.
I don't know what to tell you, ma'am.
I don't know what to tell you.
He needs to be fake.
Why did you think shouldn't we take him to like a church?
I feel like that's more like, the garlic and the holy water. I'm a hospital. I can't cure vampirism.
We have to try.
Fine.
Hi, Johnny.
Fine. Get him out.
Put
Where
the
is he?
gun down or I will be calling PD.
Where
We have
is
a
he?
spider.
Dex, come on.
Yeah, put the gun down, dude.
Johnny,
Okay, so we need him. Yes.
put the bat away, please.
Oh, this bat was fine.
I have boo-boos.
It's at a point
So
of
Dex
just
isn't
kind
here
of.
right
Excuse me. Just delivering a
calm
package.
down.
My bad.
Yeah, we need to cure Dax. Like he keeps like biting people.
Don't take this personally.
Sir?
Okay, so look, can we sidebar, doctor? Sidebar. So like vampirism probably isn't the thing, right? But like he's trying to bite people and he's like drinking blood and stuff. Like there's probably
I think
rabies
the
or something.
doctor's not being cooperative. I think we're just gonna have
Like
to
we
bring
need
him to
literally
church.
anything. We don't know. We gotta cure him before like he bites more people.
How?
ice
pack would be I don't.
No, you're
Oh.
going to the church.
Do you actually need an ice pack?
I do.
Okay, I
Go.
can go ahead and give you an ice pack.
Thank you.
You're welcome. I'm gonna
They're
go ahead
so
and give you
mean to me. Please. I'm being held hostage.
that. Uh-huh.
Begging you.
Yeah, am. Where's Flowers?
Why are you trying to bite people? Other than the obvious, I'm a vampire.
Hey, hey, hey. You got no proof of that. You got no proof of
I
that.
mean, you literally said you're a vampire.
Doc. Hey, Doc.
You
Doc,
literally said you're a vampire. That's enough proof for me.
Doc. Please. Please. Let's not do this right here, right now. I just want you to
I
call
am
the cops.
asking a simple question.
Yeah.
I'm not like everybody else pulling weapons and cornering you. I'm asking you a simple question.
He's dangerous.
You heard him?
Don't get too
Dangerous.
close to him.
Don't get close
Think
to
about
him.
it, Doc.
To him, he bit Benji.
You bit Benji? You realize that's technically assault. Or what the fuck would that be considered?
I don't know, but he's trying.
It's not assault. It's more than assault. You fucking like bit someone.
It wasn't on purpose, I swear. I swear. Just a misunderstanding, please.
A bite is more than a misunderstanding.
A bite is a bite. It happens. You know, it happens.
It shouldn't happen.
It shouldn't happen, but it happens. Anything can happen.
Larry, okay?
My face is numb.
He's got a very pretty face. He's
Come closer.
Don't.
I gotta ask you something.
Don't do it.
Yeah, I'm not doing that. Especially
don't
after you
get
told me
closer.
you bit Benji. No.
I fucking told you he's crazy.
But I'm
How do
also
you
not
underst-
gonna let you bite me.
David, shut the fuck up.
Do you understand the gun now?
Yeah.
I understand it, but at the same time, you can't have a gun out in our hospital.
Yeah, that's right. It's my hospital. Get out of here.
It's
That's
not
right.
your
Jack,
hospital.
guess what? The governor sent me a message. He said vampires can't be landowners, and he gave me the hospital. So unless you want the hospital,
You don't have the hospital.
unless you want the hospital back, you're gonna have to not be a vampire.
I mean, if he's a vampire.
It's my hospital now.
What the hell is happening right now?
Oh my god, he's Pharaoh.
It's my hospital, and guess what? It's my casino.
Yeah.
Please stop with
Casino's
the
mine now,
weapons.
too.
For the love of God.
Damn you, David. Damn you.
Zero aura.
For the love of God,
Zero
please respect
moon.
the hospital's rules and do not have weapons out in the hospital.
David, weakling. I'll destroy you right here.
If
right
you
now.
continue to hold out a weapon or pull out weapons, I will be contacting PD. Dax, is it?
It's scary.
Is it Drax or Dax?
His name is Dax. Dax Nicholas.
Hello.
Echo 74 to dispatch.
My disciples. Oh, nice.
Hey man,
Send
it's
it.
Trevor Control,
Cuddy,
man.
you need to help me
I
right
have
here, right now. These
one
people
police
are trying to
officer heading
attack
back
me.
to
I need my
pillbox for
disciples more than
a
ever now.
laceration to his face.
Oh, you're
Other than
all
that, everyone
right.
else
That's
will no longer need medical.
We have David.
10-4, if you can take care of that. I mean, and if there is a PD officer down there,
He's
can
a
you have him come up
vampire.
to the
Look at his eyes.
triage room?
Take the glasses off, Dax.
Kind of dealing with the
No.
situation of the
Take
whole
the-
vampire
take
and
the
people
glasses
pulling
off.
out weapons
Take
constantly.
the glasses
should
off,
I do
Dax.
that?
Show
Yeah,
him.
10-4, I will have a
What's going
an
on here?
officer
Who
76.
called for us? Who needs us?
No,
Alright, hello, what happened?
Disciples unite.
Wait, what happened? Oh.
Dax, take the
Hello.
glasses
Disciples
off.
Unite. Dax, what's going on, bro?
Dax, take the glasses off.
This guy, David, and this
Show him.
one, Johnny.
Show
they
him,
tried to
Dax.
attack me. They tried to assault me, rob me of all my valuable goods.
Show him.
I need your help.
Show
Don't
him.
listen to him. God damn it. Don't listen to him.
Show him.
We tried to
Take the
destroy
glass.
Dax.
Take.
Alright, if you guys just want to sit on near the green chairs or wait near the green chairs, that'd be preferred.
Alright.
Hello.
Okay, I was gonna say she was in a coma before she went to sleep.
Okay, if you want to do a vitals check. Um,
Vitals seem good.
okay. I'm gonna just do a little portable MRI here to check on that swelling and see how we're looking with that, or if we're gonna have to push some more mannitol. Little MRI machine back up for me. Basically, it's a quick little portable MRI CAT scan. Just checking and seeing if the brain swelling has improved at all, or if we're gonna need to apply mannitol to the IV. Alright, looks like it's improved, which is good. I'm gonna go ahead and
Good.
notate that. Is she on a medically induced coma or a regular?
It was not medically induced.
Okay.
Echo 4, can I get a bus headed my way? It's marked on the dispatch.
Would you like me to handle that? I'm the only one available at the moment.
Are you okay if the EMS trainee heads over that way? Because 2 of us are not cross-trained.
10-4, I need something to carry a patient. We're gonna be a black tag.
10-4. Yeah, go ahead. Echo 74 is hanging over there.
10-4, Doc, I'm gonna need you to probably call this, by the way.
Oh, good. Just let me finish up in the ICU real quick.
Okay.
Alright, my dear. We're gonna go ahead and have some people come visit you. I know how comas work. You can hear me, you just can't respond. So I'm just gonna let you know you have some friends heading over here. Alright, so the 2 of you who are on her eyes contact can come visit. Unfortunately, you're not on her eyes contacts.
Yeah, no, I'll just wait here.
We'll check on her for you. Alright, this room, right?
Yep, it's gonna be on the bed all the way in the end. I'm gonna go have to do things, yay. I was gonna go cry in a corner and write 2 witness statements, but now I have to go call something, and then 2 witness statements. Ugh. Oh, I need a second. Okay. I love my life.
875, 1041.
Life of a senior doctor, am I right? 10-4, welcome aboard.
Echo 01, 1041.
10-4, welcome aboard.
Welcome aboard. It's a little bit of a show right now.
A firm.
Echo 11, Echo 46.
Send it.
Would you like a second pair of hands for the black tag?
If you would like to. Echo 486 is heading down to lower.
Did I hear black tag?
Potential, yes. I mean, yes, but need to call it.
10-4, I'm on my way.
What is your ETA Echo 4?
Give me 2 minutes. We're just finishing up here, and then I've got a patient that's gonna come in as well. 147.
10-4. I wanna cry.
It's all gonna be okay. We got this. We got
I
this.
have 2 fucking witness statements and a black tag. Blech.
I have one witness statement and a black tag. This looks really bad.
Echo 4 plus 176. 147, 1 block tag.
I got this. Blech. I want to cry, Kia.
Why?
2 witness
I
statements.
have 2
and,
witness statements, and then we have the black tag situation. I have not done the witness statements because every time I'm about to write it, something else happens.
Okay, I'll handle the black tag. It's fine.
Thank you.
I'm here.
Yeah, it was just me and Arthur and Trini and Dan, which Dan came on duty at the perfect fucking time.
Yeah, we had to report another intern making death threats towards a patient.
Not a patient, not a patient.
A patient, not a patient. An individual. I
It
mean,
was
still.
jumbles. I talked to Dan. I'm gonna be writing a witness statement on it, but yeah.
As am I.
Yeah.
Okay, I need those immediately, please.
Yeah. I'm
Yep.
I'm working on that one and a whole nother situation that was in the triage room. So I'm gonna go hide. Actually, can I hide in this
Yes.
laboratory?
Where
Yes.
would you?
Perfect.
Where would I write this witness statement?
If you-
123
yeah,
per box.
if you use your job watch,
think
you'll
about-
go to documents and issue documents, new citizens document.
Oh, okay.
Or you can think about documents. That works too.
Oh, that works too. Yeah, I didn't even think about that.
Go hide in the laboratory. I'll handle the black tag.
Okie doke.
Alright, do you know how to? Oh, do you know how to call when you're on break, or when you're
is it-
like available or unavailable unless urgent?
No, I do not.
On radio?
For the black tag, you guys want them in the morgue or in the OR?
Yeah. Yeah.
Please, I got it.
Say it.
Morgue.
10-6.
10-4.
Yes. Yes. What is your call sign again?
11. Echo 11.
Is it 11 or 14?
I'm 11.
It didn't sound very confident.
Damn it. You're.
Echo 11 plus Echo 46 is going to be 10-6 in the laboratories. Alright, let's work on those documents.
So, issued documents and a new citizen or new document?
New citizen document, and then it'll be witness statement.
Oh, okay.
I almost dated it back 2 years.
God, wait, is it? It's okay. It's year, month, and then date.
Month, date, year.
Jesus.
I know it sounds backwards, but
So I've got medical intern Jumbles was rambling about a man who pulled his gun in the hospital, claiming to be a clown.
I'm gonna be on Sam's 3 for the
Give me
autopsy,
a
so
minute.
please don't disturb me while I'm doing that.
10-4.
Give me a minute because I'm gonna write mine and I can't write mine while you're talking, sorry. So just wait and try and fill in what you can about, you know, a situation like you calling over to Echo 4 and then me ending up finding you instead because Echo 4 was unavailable and all this stuff. Like, all the details you can give will help her.
Alrighty.
Also, if you know who all was there, like 2 unknown females for me, Jumbles and Johnny. And then 1 male that they called David. Arthur, is it Talon?
Yes, it is.
And Arthur, O-R or E-R?
You are.
You are. Oh.
ARTHUR. Yeah.
You're not comfortable with this?
No, I'm fine. I was just making sure, you know, yeah, okay.
You are in training,
Don't
which
mind me,
means I'm
I'm
gonna have
just-
you take priority. Alex, what are you holding right now?
I'm just checking his ID.
Okay.
I'm,
Then whenever you're
there's
done
3
with
gun,
that,
we got,
hold on. Whenever you're done with
Oh,
that, I'm
sorry.
gonna switch places with you.
Okay. Yeah, let me... Okay. I can't get in his pockets right now. Whatever. I'll deal with it later.
that's okay. He's not going anywhere from now on.
Yeah.
Alright, what's going on?
We've got 3 gunshot wounds to the chest and abdomen, I believe it was, through and through, and they have been packed and sealed. I've started the IV. Vitals are low but holding, I believe. Oh, hang on. Let me check that again.
What is in the IV?
It's just a standard saline IV at the moment. I didn't want to run blood because I don't know his blood type, so. Though I think we do have the universal blood, right? I don't know.
One more time? One more time with that, Lisa?
Oh, we still, yeah, no, it's okay. It's okay. I was talking to myself on that last bit. Sorry. The IV's running in saline at the moment. I didn't know his blood type, so I haven't started that. But I've just started removing the packing on the first wound, which is the most major one, and starting to flush it, clean it, and make sure there's nothing in it, and it hasn't hit anything vital.
Okay. I'm gonna have you take priority. You tell me what you want me to do. Think of me as a nurse right now. I'm gonna help you with your medications and sectioning and everything you would need me to do.
Okay.
If you get stuck, you let me know.
No, yeah, no, thank you. Doesn't look like anything vital has been hit, so we're pretty lucky on that one. So I'm guessing it's just going to be a standard clean out, stitch, and dress. Sorry, it's still early.
Is there none lodged? They all through and through?
I believe they were all through and through. Let me recheck. Sorry, I got distracted again. God
You're
damn
good.
it.
Squirrel. Okay. Yeah, I see them all three.
Yeah, there's all the exit wounds here on the back, so probably gonna have to do the exit wounds first.
Do you know a way of checking for any internal damages without, any clear line of sight?
Pardon?
Do you know how to check for internal damages without clear line of sight?
Oh well, I mean, vitals is a good indication, obviously. Whether the bleeding is pulsing or whether it is spurting is also another one, or whether it's just pooling.
How about our
Generally
machines?
that's. I mean, I could always X-ray to check for, and also ultrasound to check for.
I wouldn't do the
inner
X-ray,
debris,
but I would definitely do the ultrasound.
But I would flush and clean first before I did that. So.
Oh, 100%. I thought you were actively doing that. My bad.
No. Yeah, I am.
My
I'm
bad.
cleaning them. No, that's okay. I'm cleaning them at the same time as we're talking. So yeah.
Yeah,
I'm flushing
no,
and cleaning.
you said you were doing that. That's why I thought you were actually doing that. My bad.
Oh yeah. No, I want to get the exit wounds closed at least first because obviously they're going to bleed the most, and then do an ultrasound to make sure that there's no internal before I close the entrance.
Yeah, I was just quizzing you more or less.
Oh, good. If you like, hon, you can start stitching up each wound after I check them and make sure they're clean.
As I said, you're guiding me. All right, those two are done.
Thanks, son.
And there you go.
Perfect. Okay. And we'll just dress these and then.
Langley, just be careful. There's stuff out here. Just be aware that unless you have him on a crime, we'll need to just ask him to show ID, whether he wants to kind of volunteer that information. So we need to kind of, do you want to give ID and everything else? It's not like it's a hostage in a scene where they possibly have information on them. But see if he volunteers any information.
And would you like me to help you with anything else?
I think that was all that there was.
Are we sure?
Oh, I was just doing a top to toe now, hun.
I like you. Do you have experience?
A lot. Yes, a lot.
Perfect.
I don't mean, yeah, I'm not gonna, you know. Yeah, I've done a lot.
After this, I will formally introduce myself.
And I wasn't top of my class, but I was in the top 75%. So, you know.
I learned over time.
I learned more from being in hospitals than I did being in the school, in the classroom.
Right.
All right. I think we're all
think
set.
we're
I
good.
can't
I
seem
don't
to
see
find
anything
anything else. Mm.
All right. Well.
All right. Just gotta ease off the bed a little bit so we can make sure that he's good, and then he can wake up.
And see if he wants to go to ICU or stay
Mhm.
here.
Yep, we'll check that. And just need a.
Is he a 95 or?
No, I would just like to try and get a statement from him.
Gotcha.
Okay, so recovery. It sounds like.
Mm-hmm.
All right.
like-
Nancy, can you help us ease him off of the bed so we can, get him up on his. There you go.
Thanks, hon.
So who is it?
Perfect.
I am
Alright, now
just
we can
about
go
to
back in
find
the
out.
bed, although he
was,
might as well do that when he's
very
not
stuck to the
flopped.
bed, which sewed his pockets shut.
Otherwise, he will go yeet.
Okay.
Here. Let
There
you.
we go. Oh, yeah.
Alright,
Sorry, hon.
see if he wakes up on his own. If he doesn't within the next couple of minutes, then we're gonna use some smelling salts. God, those are wretched smelling things. Alright, and we are gonna need
Yep.
a medical report for this one.
Have you guys ID'd him?
No, we haven't been able to do that
He's
yet.
been unconscious since he came in.
Okay, let's get the local doctor to see if he can show us an ID.
Nancy, I might need to ease him out of the bed so he can do that. Let's move
Yeah.
over here so we don't get his ID.
Langley. Have him to the bed.
Okay.
I guess that changed from a 95 real quick.
Novak, I need you in lower. Now.
So he is a 95.
I guess he is a 95.
Guess so.
Okay,
He is
well,
now.
I'll change that. Do you have a name so I can put it down on his report?
Lupin Eve.
Lupin
Okay.
Eve. Okay.
Oh. Yeah, that'll fucking do it.
Okay.
That's not.
Are you doing it, hun, or do you want me to?
I'm gonna have you do it because I'm gonna see how your MDC
Conway, you
reports
on
are.
radio?
Oh yeah, no, my
think
my
he's in our
paperwork at some
chat.
point. Don't you worry about that. But yeah, I'm happy to do
He's
it.
in police.
I love paperwork.
Conway?
Alright, I'll step over here to do the paperwork.
You able
Do
to
not let him out of your sight.
Yep.
This guy's facing capital murder.
Okay.
We got Princess Sparkle's glitter toes. We got Lupin Twilight's glitter Eve. You know who. He's here in Pillbox.
Save what you have right now, and then we're gonna move away.
I had a sense something was up.
Is there a
We'll be
chance he's
safe
going
here.
to ICU?
No,
he's
he
staying
should
in
recover.
recovery. Now, if he doesn't wake up in the next minute, let me know, and I'll do some smelling salts to wake him up.
Cool.
Cause, yeah.
I need you to keep this quiet. Nobody can know that he's here.
I mean, I can't even say anything either way. HIPAA.
I mean, to other doctors.
Oh, okay.
Oh, should I not put this
Is
in a
this,
report then?
It can go in a report. Just don't mention it to anyone for now until we get him out of here.
Got you. Okay, no
This
problem.
sounds high end. Jeez.
It's one of her capital murder.
Oh, Jesus, fuck.
Something like that.
Lower.
Go back.
He's awake.
Handcuffed to a bed.
You say.
How are you feeling?
What happened?
You got shot. Doctors took care of you.
Why am I cuffed to a bed if I was a victim of a kidnapping and shooting?
We'll have answers for you in due time.
Great. They get away with assaulting someone and kidnapping them that was trying to purchase a vehicle that was paid for at Elite Autos.
Echo 74 is 23.
I still feel in a lot of pain, like I'm only 10% of myself. Can I get some more medication or something, please?
I'll see to it that you receive treatment. Can we get the doctors back in here so he can get some painkillers or something? He's only feeling like 10% of himself.
Hey, doctors, are you able to see him? He apparently he's still in a lot of pain.
Okay. I'm gonna have you save that, and then you can, I wanna see what you can give him.
Yep, hang on a minute.
Give us just a minute, Alex. I'll be in there in a second.
Sorry, I had to put my name down first. Okay. 3 gunshots. Hello, hello. Alright. So, Out of 10, how are you feeling?
Good 10% of my normal strength.
Okay. Okay. And are you allergic to anything that you know of?
Not that I'm aware of.
Okay.
There we go.
Yeah, I'm probably gonna. Honest.
I'm
Do you
tightening
need
the
him
bandage on him.
completely loosened? Officer? Officer, did you need him
Alex.
completely loosened?
Um,
I'm only asking.
Uh,
I'm only asking because otherwise he might be a little bit woozy from the pain medication. Is all.
I think for now we'd prefer that he be lucid.
Perfect.
We can do
But
Toradol.
if you,
Yeah, I was thinking Toradol as well. Yeah. No. That's fine. We can give him some Toradol. I was asking because obviously it just it matters. So.
do what you medically gotta do, but
Hold on. You're not putting me in a fucking medically induced coma. I'm awake and conscious. I just need painkillers.
It's more of your ability to answer their questions.
Yep, whether you
and
would get morphine or.
Toradol is as good as it gets, where it's not going to mess with your brain.
Mm-hmm. We're not trying to put you
It
in
also
anything.
it's kind of my go-to for painkillers as well.
Okay, because that sounded really suspicious is all I'm saying.
No.
It's
I
just
was
wording.
checking. Yeah. I was just checking because lucid
Okay.
means otherwise I would say, do you want him conscious, right? But no.
You know
It's
how
probably
like
just
when you
my
smoke
brain
weed and you
being
get
fuzzy
high and
still.
like fuzzy and everything? Yeah, it's kind of like that, where you can't necessarily be able to be asked questions and be able to answer them properly. So
All
Toradol,
right,
you'll still be able to, and you'll get some pain relief.
Yeah, that pain medication should be kicking in here very soon.
Thank you, doctors.
You're most welcome. All right, I'll finish that report.
What's up?
Echo 74 is code 4,
Hi.
76 back to pillbox.
How's it going?
What's happening, huh?
They don't know there's somebody in custody. You can't go over there. It's not allowed. No. I'm gonna go that way.
Oh.
I'm gonna go that way. Thank you.
I can't.
Let's bring him over here. Over here. It's more secure. Let's get him up on his. I'm gonna go ahead and get him up on his feet before he gets on the bed, and then you wanna give him the
Oh,
bandage.
yeah, yep. That's right. I remember that. Yeah.
4 GSW is lodged in his chest, it looks like. I don't see any exit wounds on these. I'm gonna go ahead and pull the scan over and see if we can locate where these are. In the meantime, can you check his vitals?
Yep.
Right, with this scan, I'm checking to see if there's anything internally hit. So lungs, liver, kidney, heart, which heart would be very questionable because he is still breathing. Just artery, anything like that that I can see from the scan.
Vitals are of course low, but I mean that's a given.
Yeah, he was shot.
Sorry, I shouldn't giggle at that, but yeah, you know.
Yeah, no, I understand.
I do have the IV running,
Okay.
of course.
Do me a
and,
favor and check his airway while I'm looking over the scans. Okay. I'm gonna look over that one more time, just because it's really fucking fast. Is that saying 2 GSWs or the second GSW? No, I understand, Nancy. I'm trying to say, is this like GSW2 as in like the second GSW, or 2 of the GSWs are there?
Oh.
Okay. We're putting him to sleep. I thought that's what the IV was for. Go ahead and add propofol and hold on. I know his name. Brett. Brett Sabian. Allergies.
The anesthesia is running now, so.
I don't see any allergies, so
Okay.
we're gonna go ahead and you have propofol and I would say hydromorphone. For pain. Then
Yep.
a blood
Try and
bag.
keep him asleep as well.
I'm gonna go ahead and make an incision to his chest here. We're gonna go ahead and have you do some suction while I clamp an artery that I am seeing is bleeding out. His aorta. Right, incision being made. Incision made. Now I'm gonna go ahead and clamp. Alright, clamps placed to the aorta. Right, suction a little more so we can see where we're looking at these bullets. I want to try and remove those before I do the repair due to how close they are to the heart. Alright, checking if I can safely remove this bullet.
Looks like you got it there, hun.
Still trying to see if I can safely remove the bullet.
Oh, no, you did.
Oh, I did? Okay.
Yeah, you might have missed. Yeah, that's why
Yeah, I
I said
definitely
you,
missed
you
it.
got it. Yep. That's okay. That's okay.
It's okay. Alrighty.
Sorry.
You're
Sorry,
good.
I got a little bit. I thought you. Yep. Okay.
You're
all
good.
good.
Alright. In the tray here.
Looks like the entire bullet is here, hun.
Okay, second bullet. Near the heart. Let me see if I can remove that one too. Excuse me. Alright, plopping it in the tray. Alright, now with this artery, there's 2 other bullets in here, but I want to go ahead and suture up or repair his artery before I do anything else. Because can't be blocking off that blood flow too much. So, with this artery, I want to see if we can suture it or if we need to do a grafting.
Police are asking for an update if there is one.
Currently still in surgery.
Okay, thank you.
I love them, but damn, they're pushy.
I had an incident with them earlier where they just kind of rid me off. Wrote me off or something. Even though I was the witness to everything and called for them.
Yeah, I've not had the best experience with them here yet in this state, so.
It's
Anyway.
being dealt with. Let's just say it that way. I went to my command about it. Yes, so. Artery. Grafting or suturing?
What was that, sorry?
Do me a favor, second pair of eyes. Do you think grafting or suturing for this artery?
Oh, it doesn't look too big. I would say probably just probably could just I don't know. It does tear quite a bit. I'd say
I think grafting. Do you? You would think so?
I'll lean on your experience on that one, hun. I'll lean on your experience. But I would I would back you on that. Yes.
Yeah, alrighty. I mean, there's very little chance that people will be able to just get sutured up, but, you know, there's always gotta check. Alright,
Of
do me a
course.
favor and grab the artificial artery graft behind you in the cabinet. Or behind me, I guess, in the cabinet.
Oh, you need me to get?
No,
the
Nurse
cabinet for
Nancy.
you?
Nurse Nancy.
Oh, sorry. I thought you said.
I
Sorry. sorry.
I didn't specify who. I'm sorry.
No, that's okay. That's okay.
All right. Thank you, Nurse Nancy. All right. I'm gonna go ahead and place this graft. I'm gonna cut it to be a little bigger than what we want, just so I can trim it as needed. All right. A little less. I'm gonna go ahead and trim that. Thank you. All right. I'm gonna go ahead and suture the end of this onto this side. There we go. And then I'm going to suture the end on this side as well. Perfect. I'm going to slowly remove the clamps if you want to add nitroprusside to the IV. It helps with when the blood goes through the artificial graft to not cause him to have his vitals go crazy. Because at this point, it is blood rushing through your vein or your artery. Alright, let me know when you've added nitroprusside before I remove this clamp.
There we go. God, I could never spell that fucking thing. It always confused me. Anyway.
You're good. Alright, I'm gonna slowly remove this clamp and see if this is holding or leaking.
Vitals seem steady-ish from what they were. They have improved a tiny bit, I think. No. Let me do another scan. Yeah, heart rate's starting to come up, so BP should follow.
What is his heart rate at? 'Cause I know it was high for a little bit, but to be fair, he was also, like, artery.
No, it was low. It was low.
I thought it was at 147 at some point.
Wait, was it?
Yes, but that's also
did I miss
because
that?
artery. Unless I'm seeing some shit in another room.
I thought I saw. I was so sure I saw that it was.
Okay.
Okay, it's
I
come
saw
back down to about-
147 at one point.
Okay. I don't know. I might have. You might. Hey, look.
I might have seen 147 at some point earlier on, but I might have seen maybe Nancy passing by with some, somebody else's report. Who knows?
I know there was some surgery going on next door as well. So.
Maybe they were shouting numbers at me and it confused me. Anyway, yeah. So
Okay.
I'm gonna go ahead and see if I can find
Finish
these
up
other
the
two
rest of
bullets
this.
since this artery is holding,
Mhm.
and then see where these are located.
I'll stitch the one that you finished with.
Huh?
The wound that you're finished with. I'll stitch the
Oh
wound.
no.
closed.
No. I made an incision to make it a little bigger so I could access it better.
Oh, all of them. Okay.
Yes.
Sorry, I didn't know it was such a tight grouping.
No, there was two at the heart, so I wanted to make sure that I could make an incision to be able to access those. Alright, left lung. Well, good thing we intubated, right?
Mhm.
Alright, left lung. Let's see if this is punctured. Or if it's just
I've had him hit the
floating
ribs
near it.
before.
Or even ribs, yep. I'm more looking at the bullets right now. And And then I'll check his rib cage and lungs are also of main focus right now. Hey! Get. Shoot. Penetrated in left lung. Okay, perfect. Not perfect, but perfect. Now we got an answer. Alright. I'm gonna go ahead and carefully remove these bullets and see if I can safely remove them. Doing all the tray and suction. Alright, Nancy, second pair of eyes, can you move this?
And there's your drainage, just in case when you remove it, the lung fills up with blood.
Still trying to see if I can safely remove these bullets from the lung. Perfect. Removing first bullet. And there's the tray. Alright, now second bullet. And in the tray. There we go. Alright, suction. Nurse Nancy, can you give me a biomesh for his lung? Thank you. Appreciate you. Alright, I'm gonna go ahead and place this biomesh around it. And, oh, I'm gonna have to trim it. It's a little too big. Trimming. Alright, that's perfect. Alright. I'm gonna go ahead
I
and...
was going to say something dirty there, but I decided against it.
I'm gonna go ahead and suture. I knew I liked you. Anyway.
I mean, you should like me. I feel like we definitely know each other pretty well. In a sort of semi-way.
I don't know if I know you.
No, but the personality is definitely there.
Alrighty, I'm gonna go ahead and get this biomesh on here. There we go. Saline and suction, check for any bubbling.
Perfect. Doesn't look like it, so I think we're set.
Perfect. Ms. Ma'am. Ms. Ma'am. No. No, you know better. Get. Cats, I swear. Alrighty, perfect. Alright, now let's see if there's anything else. I do see some small little blood vessel bleeds, if you can cauterize those. I will do the section for that while I look over everything else. Do the little zip zaps. Zip, 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 zap. Zap, zip. Perfect.
All right. And there goes the last one. All right. Should be set to clean and close. Wait. Yes.
Perfect. Sorry if I missed anything else. Whoops. Let's see if we can figure out if there's anything that we are not seeing or we didn't see on our first run through.
Oh, if you missed it, darling, I missed it. Don't you worry about that.
We are all good. All Gucci. I don't see any issues. So we're gonna go ahead and get them all closed up. And then Nurse Nancy, do you think he's going to need ICUs or recovery? Is he stubborn for recovery or needing ICUs? ICUs. Perfect. Have you done an ICU intake before?
No, but I know how to do them.
Perfect. I'm gonna have you do it then.
Okay.
I'll do the I'll do the report. You do the intake. Alrighty.
I just need to find a spare bed.
Yep. Which I would like you to figure out which one is free.
Looks like 80% of the beds are free anyway at the moment. Only bed 1 in room 111 and room 108 is taken at the moment, by the look of it. Unless we got some really, really long-term people. Or unless they haven't been put down as discharged, because I'm looking at the, you know, admittance and...
Looking at admitted, and I'm seeing like hella beds full.
Yeah, there's hella beds, but some of them are... Oh, hang on. Some of them are from 4 days. Okay. 3, bed 2, 109. I don't even know what beds we have over there completely, so... I know we have... Oh, no, bed 3 is taken.
110 bed 1 we can use. Which... I am very fucking confused now because I could have swore I was told that it was 1, 2, 3 for starting from the door, but then I'm seeing people in apparently bed 1 and it's the one farthest end. So I'm kind of lost. Because I was told 2 different things.
I guess I'm probably as lost as you are now, honey, so... Yeah. Alright,
Although I'm also confused because there's 2 ICU admittance for the same person.
There's also 2 in the one bed. Oh wait, no, never mind. Never mind. I read that wrong. Ah!
I'm so
Okay.
lost.
It's okay, we're putting him in 110 anyway, aren't we?
Uh-huh.
The one closest, the bed closest to the door. Alright, and I'll have to let PD know as well.
Alrighty, I'm gonna go ahead and move him over there. Nurse Nancy, can you help me get him out of the bed? And onto the stretcher. Thank you.
I'll get the door for you.
110 bed 1.
Yeah.
Oh shit.
Babe, I'm gonna need a hug.
I was here to give you one anyway.
Perfect. I think this is bed 1.
I'm pretty sure it is.
I'm pretty sure it is too, but I'm being told that it's in. Like,
I was told this is bed 1.
exactly
Listen, when I was given
one,
a
two,
tour,
three, 1, 2, 3. But like,
Yeah.
she's in the far
Door
end bed over
outward.
there, but she's marked in both bed 1 and bed 3, and now I'm confused.
fuck it. She's in bed. He's in bed. We're set. Okay. I have to do this.
His name is Brett Sabian. Brett space Sabien. I'm also gonna have you contact.
Wait, you said Stabin, right?
What? No. SAB,
what-
as in boy.
Oh, SAB. SAB. Okay, yeah.
IEN. Brett Sabian. As far as I know, these beds are fulfilled.
Yeah, we're just gonna monitor her status for a few nights, and surgery went well. There was a few things wrong with her. Before I go disclosing anything, if I could what is your... It would not appear that you are on her bias list, so I'm not going to be able to give you any information about what happened during the surgery.
No, that's fine. I just needed to know she's like gonna be alive. You know.
I mean, technically, you're not supposed to be back here if you're not in the ice contacts.
Yeah.
So if you can do me a favor and head over to the chairs and we can talk to you out there.
Alright.
I'm sorry.
576.
It's just a patient privacy thing. As far as I know, all of these beds are taken.
This is the one that Kia told me to put her in.
Bed 1?
Bed 1?
Bed 1 is over there. And we have taken that one.
She said bed 1 was the one farthest from the door.
What the fuck? I'm getting told 2 different answers.
Can you look up Seraphine Voss and read out her ice contacts to me?
Oh,
I've got Scarlet.
1 second.
Scarlet's
Sorry,
phone is
I'm.
off.
Are you her eyes contact by chance?
Fuck. Okay. I'm. You said Seraphine Voss.
Oh, God, your body metabolizes.
You said you have
propofol
who?
fast. Indy Rhodes, if you wouldn't mind reading her number out to me.
576-4629.
Thank you.
We have to move him to a different bed. To a
Really?
different yeah, because apparently, apparently over there is bed 1. Which doesn't make any sense.
Okay. All right. So where are we gonna go to? Oh yeah. Yep. I was.
I don't know.
All the other beds. Wait.
One second. Hold on. We're gonna have him stay down on the bed here. Echo. Echo 42, Echo 46. Or vice versa. We need more ICU beds.
Yeah, what the fuck are we supposed to do now?
I am calling Kia.
Hello.
I have a question.
I have an answer.
All of our ICU beds are taken, as far as I can tell.
That's not possible.
According to... Wait, what? According to the admitted, every single one is utilized by somebody. Unless I'm reading this wrong.
Okay, what room are you looking at?
Well, I was looking at 110, which we just tried to put Brett Sabi, somebody into room 110, bed 1, but then apparently you also put somebody in room 110, bed 1.
Well, then put him in 2.
I gotta go check something with my
Okay,
superior.
so despite the fact that there is a thing with bed 2 being fulfilled?
It's not? I see a single patient in bed 2 and they're discharged.
I don't see it as discharged. I still see it as admitted in... Oh, wait. Yeah. Henley, room 110, bed 2.
Well, that was like 6 days ago. I bet you they're gone.
Okay.
Yeah.
Okay.
Yeah.
I wish there was a way for us to know. Okay. All right.
Well, okay, so here's the thing. When people fall asleep, right? They get moved to a different floor.
Fair.
So
Another thing, because this is starting to really irk me because I'm getting different answers. How is the
Okay.
bed set up? Is it from the
s-
door to the wall is 1, 2, 3, or vice versa?
vice versa. It's always from the wall to the door.
Okay.
Yeah.
Okay. I got very confused because I got like different answers every time I asked.
No, it's always from the wall to the door.
Okay. All right.
Yeah, and that's coming from me, so that's the final answer. So there you go.
That's where I'm gonna finalize it.
Okay.
That's why I asked.
Yes. Okay.
All right.
Yep.
All right. Thank you. I'll move him over to bed 2 then.
Okay. Sounds good.
All right. Thank you.
Bye bye.
Lisa, come here. Who are you on
No,
the phone with?
close. Not in the heart. Close to the heart, honey.
Hmm.
You're welcome. He is down here in ICU if you wanted to come see him. Okay. Okay. You're welcome. No worries. Bye. Sorry, I just had to call Lexi because she's on his eyes contacts. What's up?
Okay, moving to bed 2. It might say. Also, I got clarification from our, director. So it's from the wall to the door is 1, 2, 3. So, we're gonna move him to bed 2. And note put him as bed 2.
Yep, done.
If it's been a couple days, like 6 days, 7 days, 8 days, put him on the bed. Honestly, doesn't matter. That's what I got from Kia.
Yeah. Because I was looking at some of these. They're a few days old too, so like.
Yeah, I mean, if
whether
you
they're
get
even still
updated
here.
reports on it, I would suggest just not like.
Oh yeah, of course.
Not putting somebody on that bed, but if you don't get updated reports in like 6 days, then just assume that they took the local doctor.
Yeah. All right. I'll just call his other emergency contact, and we'll go from there. I believe that Lexi's on her way down to see him.
I'm gonna move him to the other bed before he gets here.
Okay.
All right, we're gonna move him to the other bed. Oh, we're gonna move him to the other bed.
Welcome to come in. But then I'm not gonna go to sleep. Jeez.
I'm very
Nurse
sorry.
Nancy, thank you.
Oh, is she? Oh, she's awake.
Yeah, she's awake.
Okay, 1 second. I gotta make a phone call. Then.
Okay. Will you be safe in prison? I tell
Guidance
Bobby
of
I have to
stuff
have
here. There we go. All right.
The only reason you
Hello.
What's up?
I feel like I'm not catching a break.
I know that feeling.
Fuck, what's Lisa's number?
Come here.
75. Update for PD. He is going to be in ICU. Probably overnight. He is unconscious at the moment.
Who, what?
Brett Sabian, individual who is off-duty officer who was shot here in the lobby of the hospital by the disciples.
Fucking okay, I wasn't even aware of that incident. God damn it. Alright. I'll make sure someone is informed.
No worries. We'll see you soon. All right. Bye.
Do me a favor if you haven't already. Can you reverse the propofol? If you did, I'm sorry. I'm everywhere.
Wait. Can I what?
Reverse the propofol.
Propofol. Oh. You mean the? Yeah. You mean the medication?
The sedation, yeah. Did you do that?
Yep. Oh yeah. I gave him a fresh IV, honey.
Okay.
He should be. Yeah, he should be waking up when he wakes up, right? He's just had a fresh IV. Let me just check it, but make sure he, you know.
That's not how you spell nitroglycerin. Nitroprusside.
Clarification. Who was the scene lead for the shooting at Billbox? Tab 4, I'm just gonna send you a text. Welcome aboard.
Yeah, it's a complete fresh IV, hun.
Okay. We did saline, propofol, hydromorphone, nitroprusside. Did we do any painkillers?
Yep. There was. Wait. I did some. Fuck. I put some morphine in it, hun. His heart rate was low, so I put some morphine in it to raise it.
Morphine, okay.
Yeah. That was before I knew that he had the heart injury, and then I switched it out. Because obviously you don't want to give him morphine after he's had fucking...
So, no morphine.
Oh, shit. Wait.
Then what did
Wait,
you
no.
switch it out for?
What did I... Fuck. Hang on, sorry, I've got to look at the paperwork.
What did you
Whoa,
switch it out
whoa,
for?
whoa.
What room is he in, guys?
Echo,
Down
Echo,
here,
Echo,
hun.
1042.
I have to... let me
Cruz?
have...
They're fat.
Let me have a look at the medical...
Wait, 110. I'm sorry.
For a second.
Green.
Cruz, are you
Sorry.
on his ice contacts?
Who?
Cruz.
No, I don't think he is. There's only 2 people.
No, but I'm with an ice contact who's my girlfriend, and that's her father in there.
Okay, I understand, but you have to sit out here because he is not conscious to let you in here yet.
Excuse me, please.
But, yes.
Thank you.
But, you know just as well as I do that if you're a company and have the approval of the ice contact, they can
We
bring
need
somebody
to,
else in.
Yes, but we need to hear it from her. So if you give me a minute. Stay out here for a second. Because I need to hear it from her.
Okay, I
need to hear it from
Yeah.
you.
What?
Is he allowed to come in?
Yes. Yes.
I understand, but I have to hear it verbally from you.
Absolutely, at any time.
Perfect. Alright, gone in. Alright. If they're not an ice contact, you need to, and you know, somebody's ice contact lets them in, they have to verbally tell you that they are allowed to go in with them. They can't just walk in. We have to get the verbal approval. It's a patient risk. So if we don't get the verbal approval and we just let them in and something happens, that's on us.
God. Sorry, don't mean to snap. Just a little right now.
I completely understand. It's just
I'll be right back. I'm
verbal.
I'm going to read his I want to just see his chart. So.
I'm currently working on it. It's not done.
Oh, okay. All right. So three, you said?
Oh.
What?
Wait, it was
3
4 gunshots.
Four. Uh-huh.
There
It
was
was
2
4
in the
gunshots.
left lung and 2 near the heart, and the aorta was hit.
Okay.
I
So we'll
grafted
stand in.
his- Yeah,
Uh-huh.
I grafted and I was able to remove the bullets near his heart safely without issue.
Alright.
The long ones were removed without issue. Biograft was done to, or sorry, biomesh was done to the
Okay.
lung
Okay.
and repaired, and haven't seen any issues. Vitals have been stable. He's just been unconscious.
Okay, in the aorta?
It's been repaired.
Stent?
Yes.
All right. And so vitals are stable now?
Yes, he was on
Yes.
nitroprusside to make sure,
Okay.
you know, before I
stayed
took his
asleep.
hands off.
Okay, and what is he on fentanyl? Right now for pain or?
That's a her question. She's the one who did the medications.
Yes.
Okay.
Yes.
Perfect. Okay. All right.
Yes.
And we have no
I had to
private
look. I had to
rooms.
look up the medication guide again, but yes, that was what I gave him.
Okay. No, you did good. So there's no private rooms, right?
No, not at the
Unfortunately, no.
moment.
Or nothing that can be locked. Okay.
These ones
Sorry,
are
hon.
locked?
No, they can't. I don't think so.
Arabella, you got a spider, by the way.
Yeah.
All right.
But yeah, he should hopefully wake up here, soonish. He was obviously put under to make sure that he didn't wake up during surgery.
Yeah. Okay.
But yeah, that should be wearing off here soon. I did give him a fresh IV, so he should just wake up.
You should be waking up soon here. Okay.
Yeah.
All right. I'm letting you guys do it. I can't really. Oh wait. Sorry.
It's
Wrong-
okay.
Wrong hospital, wrong city.
You have nothing to worry about. You have nothing to worry about. You're worried about your friends.
Oh,
I'm sorry.
Yeah.
It's my dad.
Only stipulation we have is if you feel like you aren't confident enough to take care of him.
No, I'm good.
Otherwise, if you need assistance, you let me know. I don't think I have your number, do I? I might actually.
It's literally in the guide. You can just get it off of the
I
MDT.
have yours. I don't like grabbing numbers off of the MDT because I feel like it's kind of like an invasion of privacy, and I wouldn't like people doing it to
Yeah.
me. Kind of, yeah.
And it's also in his chart. In his
Yes.
As
Yes.
a
Yeah. But again,
emergency
like
ice
we
contact.
don't. We
I
don't.
know. I don't do that. I don't do that either. But I'm telling her, you guys, because I'm a doctor too.
Of course, hon. Yeah. No.
So it's okay. All right. I'll just wait. I don't know. This is ridiculous.
Just take a deep breath. You got this.
Yes, this is being a cop. Jesus, people are just so.
Yeah. We don't even know what fully happens.
You should be waking up soon. Okay.
I just needed to hear from her that it was okay if he went in, just because. Yeah, I mean, Eve is a employee, so she can, but he is not an employee, so I just needed to verbally hear it from Lexi, if he could go in. Wait, I got this.
Because I know Kareem. And I told her she told me he got
You can also note down there, hon, if you like, that vitals have become stronger.
We don't notate that on here. We notate it in the IC.
Oh, no, I see. God damn it. Yes. Sorry.
You can go ahead and do that while I do this report.
Is it post-surgery? Yeah, it's post-surgery, isn't it? Pre-surgery is before surgery, post is after, right?
I always just add
Yes.
an update. I just say update. Okay. All right. I'm gonna see if I can get a hold of Arthur. Yeah. Echo 1 from Echo 46. What's her name?
Seraphine is her name. Seraphine's her name.
I'm
sorry, did someone call for me?
Yeah, that was me. Your patient from earlier, yours and Arthur's, is currently seizing in the ICU, and I didn't get a chance to look at any of her medical stuff.
Did you push Epidiolex?
I just got here.
Push Epidiolex, I'm on my way.
Alright, pushing Epidiolex is requested by her primary and the director.
Sam's from PD. Send it. Can we be able to get you guys up to either the prison or Harmony Hospital? There's probably gonna have two individuals that are gonna need surgery up in Harmony. It's gonna be quicker for transport. Two individuals that are from the prison. One being stabbed, one has been shot. Okay, they're gonna have to see local doctors. We are simply too busy down in Pillbox. 10-4, just wanted to contact you just to clarify, just to make sure. Thank you, appreciate it.
Alright, what do we got?
I don't know yet. I just got here. He kind of ran out saying she was having issues, and I came over. She was seizing. I pushed the Epidiolex. I haven't seen anything.
Let's get an ultrasound. I need an ultrasound.
Okay.
And check her head, specifically, please. I need to see if there's anything going on.
Righty. Let's see. She was conscious earlier, correct?
Yes. Yeah, Nancy, she came in for a couple compound fractures earlier today.
Scans here.
Okay, I see what's going on.
See it too.
Okay, all right. One, it's titanium in our body, so that's taken care of. Okay, let's keep her on a slow drip of the Epidiolex then. That should help keep those subsided. And then I will talk to her about correcting that issue later.
Oh, thank you.
I'm assuming we've called her emergency contacts, right?
I believe Arthur did.
Yeah, Arthur did. Okay. All right. Perfect. All right, keep me updated. I gotta finish our report, my dear.
If there is more pain, though, we can still give him another 5.
Alright. Slow drip being placed. Go.
Thank you.
You right, love?
Arabella, could you also push vancomycin and erythromycin for me, please? That's what I was going to do.
10-4.
Add doxycycline because of her spleen.
Ow. Ow. Oh.
You good?
New doctors. Hello.
Yeah.
Mm-hmm. Hello.
Dad. I'm hoping that really helps.
Alright.
Take away whatever pain here.
What did I go to
Take
heaven?
it easy.
Lexi, did
Not
I
quite.
tell you exactly what happened to him?
That's right. I wouldn't be going to
That
heaven.
he was shot
anyway.
on the phone.
Yeah,
I wanna
look,
make
don't
sure-
worry. The horns just hold the halo
No.
string.
Just told
Okay.
me where the bullets. He was shot
That's
through
an
the nose,
understatement.
Okay.
twice in the lung, and they'll get the report.
Oh, what happened? My head
2
hurts.
times in the heart.
The report is done, by the way. It's 7-Eleven.
Thank you. Appreciate you.
I'll let Arabella explain that one. I'm
What?
not exactly sure. I was treating the other
What
patient.
happened? What? Huh?
She asked what happened.
My head hurts.
Oh, you had a seizure. Your friend came out yelling that you had a seizure, or you were. Something was happening. I came and you were having a seizure. I applied some Epidiolex per your primary doctor, Kia.
Okay.
Also applied erythromycin, vancomycin, and doxycycline per her request as well.
What is that?
They are antibiotics
Hmm.
It's
to
gonna be okay.
assist with fighting infections.
All right. Oh, fuck me. Jesus Christ. That's 2 separate sentences. I don't need Jesus Christ fucking me.
I was about to say, yeah, I mean, yeah. You were just talking about being in hell, and now you.
Ow. 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 Ow.
Alright.
Ow. Ah. Ah. What are your names?
I am Senior Dr. Arabella Romanoff.
I don't.
Oh,
really
I'm
don't know
Lisa
what to
Lamont.
say right now. I just.
Hello. I'm Sarah. Seraphine Boss.
I don't. Just be here.
I'm the car dealer at Elite, or at least one of them. Yeah.
Hard to say it's nice to meet you when you're laying in bed like this, you know. But it's good to meet you regardless.
Yeah.
Ow. Yeah, some fucker hit me as I was like sitting like I walked outside, and all I saw is
No,
a flash of
I'm
yellow.
fine. I just.
Some car. I got hit
Just
by a
realized I
car.
left your car parked out front. I locked it, but
But yeah.
maybe we should move it down.
Oh.
Yeah.
You come here often?
I thought about that on the way here, but I was just.
Enough
alright.
to know these walls.
I gotta come here often. My grandmother and
Yeah.
my mother work here too.
Oh,
do that
nice.
this far.
My grandmother's the director. Or chief,
Okay.
or whatever
Judge,
it's
I
called.
have, 709.
Wait, who's your grandmother?
Yeah,
Oh, she's your grandmother.
chief of PHS. Yep.
Nice. Who's your mother?
Lena.
I want to move it. I don't want anything.
Oh, I don't know if I know her.
Yeah, Lena Remo Marks. Which I should be having my last name changed soon.
Yeah.
Lena.
I'm thinking
I'm
about.
pretty sure he'll probably be sleeping till tomorrow, anyways.
I'm thinking about having my last name changed.
Your
Chichikov.
last name is
go to
connected
bed,
to
I'll
people
watch
I
him.
don't like.
Yours or mine?
He's gonna be sleeping
Yours.
till tomorrow.
Oh, trust me, it's no relation. My name isn't even real.
Positive, I'm not with what they gave
Fair
him.
enough. Neither was mine. I just kind of kept.
My biological name is Elizabeth Green. Seraphine is just a code name.
See you tomorrow morning.
Seraphine seems to fit you more than Elizabeth.
What? Oh, thanks. Maybe that's because it's a code name and that's what I was given. I don't know why I'm telling you this, but I'm fucking high as shit.
Yeah. You're good, you're good. We're gonna leave you alone, dear friend. Gonna go do some things up front.
Good night.
Okay, bye. Have a good one.
You too.
Thank you, doctors.
No problem.
Doctor,
Yes.
I just want to apologize about before. You were just doing your job.
It's okay. Yeah, the whole you and I both know. I was like, yeah, I do. That's also where I feel like you should know where I do need to get verbal from her. Like,
You know what?
Eve was allowed to go in because, well, she's medical staff. But because you're not medical staff, I just needed to verbally hear it. Like, I had
Yeah, I
no feuds with
understand.
it. It's just
Is
a
Javi
safety
not
thing.
on? Is Javi not on the ice contacts?
No, he's not.
Okay, well, we'll change that.
No, it's just you and Eve on the ice contacts.
Okay, yeah, we need to update that. Okay.
Yeah, which I had no quarrels with it at the end of the day, but I just had to cover my basis and get some verbal confirmation.
I understand. You did everything you were supposed to do.
Yeah, I just say I don't know, I
Appreciate
just work here. I'm a senior doctor, but I
Exactly.
don't know, I just work here.
Yeah. Okay. Thank you.
Yeah, no problem.
You're welcome.
I'll
be up with front.
I love you.
I love you too.
I'm on the verge of tears.
Don't blame you.
I gotta go find Kia. I gotta give her some paperwork. I'll be back. I'm gonna be at the front. I'm gonna escape the ICU for a little bit.
Yeah, I'm thinking we both ought to clock out soon, to be honest.
No.
I need doctor for this man.
I'll get to Kia at some point.
Why is there cone in that bed?
Because the cone is a bed.
There's a cone in that bed. Hello.
He
so-
he ejectocetoed he ejectocetoed himself from his car.
While I was wearing a seatbelt. Like that
I'm
makes
having
sense.
you up into this bed.
Well, I gotta get him, up to his feet to get in the bed, otherwise I can't
Yeah.
actually get him up, unfortunately. Kind of some dumb shit, I'm not gonna lie.
Yeah, I don't know.
And we'll be bringing him back to his car when we're done.
Alrighty.
But
I'm
yeah,
just judging him for not wearing the seatbelt.
I had my
wore-
seatbelt on.
Listen, I get
Clearly you
ejectocetoed
didn't.
from my car all the time with my seatbelt on, but I'm also going like 102
Did
most
you
of the
hit
time
your
because
head?
it's
Did you
50s.
get
No.
unconscious? Did you feel or hear anything snap crackle break like a rice snap
No.
crackle pop? Wow. Okay. Babe, I
Yeah,
think I
you
need to
went-
go to bed. I think it's
You skipped that one up a
bedtime.
little bit.
Wait, you got Rice Krispie treats? I want some.
Yeah, my girlfriend does.
I'll do a tradesies.
The question is, are the chocolate one or the regular one?
Regular.
It's the regular one. I
Chocolate
saved
one's
the
too
chocolate for
chalky.
myself.
What?
It's chalky, but I also
Slanderous.
I snapped, crackled, and popped it. Here you
Unless
go.
it's like chocolate
There you go.
filled with
Thank you.
cherries.
I don't know who got the cake, but you guys got cake.
Not me. But I tend to avoid cake due to soy.
Anyone want sprunk? I got a lot.
I'm alright. I got apple juice.
Apple juice.
Well, you're getting
I have
sprunk
ice cream
anyways.
and
Okay,
mac and
I'll
cheese.
take it. I'll appreciate it.
I got ice cream and mac and cheese and apple juice.
Thanks for the sprunk.
microwave tea.
Get
Appreciate
the
it.
fuck away from
That's
me with that.
that's a lot of spring. It's a lot of sprunk.
No. No.
I will give you the microwave
No.
tea.
Give it to Dan. Give it to Dan. Give it to Dan.
He would like it.
Do it.
Do what? Arabella is telling me to give you the microwave tea.
Oh, I mean that's the proper way to do tea.
No, it is not. Fuck off.
Do you know where
Excuse
Kia
me.
is?
You heard me.
She is writing an 8-page report right now.
Yeah, I have papers.
Oh, I love the cowboy hat.
Bruh.
That looks so good.
Hi, Arabella.
Good night, dear.
Have a good day. Hope you get feeling better.
Kia. I have papers to give you.
Okay.
Once I figure out how to.
Yep.
Is the copy?
Yes, copy. Yes.
Okay. Alright, that's mine. Did Arthur give you his?
No, I don't have anything from Arthur.
Okay, he gave me it. I don't know if I can give it to
Show
you.
it. Show it to me. Okay. I got a picture. Let me look at yours.
And then I have the one for... Did I give you the Jumbles threats or the
Yes.
triage
Yeah.
mishap?
Jumbles threats.
There's the triage mishap, which I'm not sure exactly what I was supposed to write in it, so I just wrote the TLDR and then the fact that PD kind of just ignored me, even though I was the one who requested the assistance. Which I'll actually give that to Dan since he was the one working with
Yeah.
that.
Have a good night.
Hi, Dan.
Hi. What's up?
I have paper.
Oh, perfect.
The one with the threats I gave to Kia directly, but this one is for
Okay.
you. That's from
All right.
the whole situation in the triage from start to getting ignored from PD.
Oh, yeah, I gotcha. Thank you so much.
Mhm.
Are you reading the reports? Yeah.
Do I commit Dr. Theft now? What if I just pick you up and shout through the window, Kia, I am stealing your doctor, and run away?
I'd have to clock off duty. Want me to do that? And then, yeah, I'm gonna do that, and then, yeah.
I'm gonna do the same.
Doors. Shit. Echo 46, 1042. Echo 46 is 1042. Have a good night.
Service.
Also, my depth perception isn't great, and without my glasses, it's not good.
Lisa, I'm going to bed.
Oh, okay, hon.
Good
All
job
right.
today.
Thank you. You rest well, all right?
Where the fuck?
Thank you again.
No problem.
Hi. Okay, I'm going back.
Hello.
Hello.
Not in her doctor uniform anymore, huh?
No, I am tired.
Oh.
I tried to
You
see the
really
snap
sound like
crackle
it.
pop and I failed.
Can I ask you-
It,
Go ahead.
no, you first.
Do you mind if I ask you a quick question?
Mhm. Go ahead.
Let me think how I think. Oh, that's somebody.
What?
Give me a moment. No, just give me a moment. I'm thinking about it. I apologize.
Oh, okay.
You can, your friend. Sorry.
Hey, babe.
I'll be back.
You can't steal me yet. Give it a couple minutes. I know.
Don't let her shame your walk style. It's okay.
It's okay though.
And
Why am I still doing this?
Hello.
Oh, Chris Warren been preemptively. My car got
doors
fucked.
do silly things, I think.
Yeah, doing good. How are you?
Good.
I
good.
stopped myself from doing it
You need
Yeah.
help with
multiple
anything?
times.
Oh no, we were just gonna ask that nice doctor,
Oh no, then.
off-duty
Oh.
doctor person a question.
Oh, okay.
How are you guys all doing tonight?
Good. Also, question.
Question. Okay. Ooh. See, I'm not good at talking sometimes. My bad. See, you got me nervous. That's not good. I'm sorry.
Just come out and say it.
You can do it. I believe in you, Tom.
Okay. See, there's a crowd, and I'm not good with crowds.
You're fine. Come on. We've heard
Okay. The
heard
crowd will
everything here in
stare
the
at you.
hospital. I promise.
Oh, now they're staring at me. Okay, okay.
Yes.
Yeah.
Oh.
If you, I can't. I'm gonna go.
Oh
I'm
my
gonna
God.
Stand somewhere. I'm gonna get a drink.
What is he trying to say,
She's gonna
Nathalie?
take over. She's gonna take over.
What is he trying to ask, Nathalie?
How cute.
This is what I have to deal with on a daily basis. So, the thing is, Miss, is that when we were, giving you our number for our interest in the EMS side of things, we were a little bit confused, and then the clown incident happened. So we were like, okay, maybe we're able to come back and just ask her, like, how is this the contact and how long usually takes, so we can make sure that we are around,
It all depends on when somebody from EMS is available, which you will receive a text.
All right, so it will be directly to our phones.
Yes, that's why I requested your phone numbers, because and your IDs, is because your name and your phone number and what you're interested in, being EMS or PHS, gets sent to our interview requests. And
Yeah.
somebody who does interviews will reach out to you guys and will reach out and try and schedule an interview with you guys. So just keep an eye on your phone.
Yeah. No, that's perfect. Thank you for the clarification.
Are you safe from the clowns?
I mean, there's some that work here.
Oh.
For now.
Well, the ones that were he like came in and did like a tuck and roll and karate chop, the one with
Again,
the gun
I don't know. Probably for now.
verbally. It was pretty impressive, the whole verbal taekwondo you did on the clown people.
I mean, you don't pull a gun out in my fucking hospital. Like, it's that simple.
Understood. It was pretty amazing. That's
And
all I
then
was.
him being, well, I need to protect myself. Well, I picked my battles. I'm like, bats are fine for now. But, like, put the gun and the knife away. This is my hospital. You're now a risk. If you continue, I'm calling PD. I still have
I
to
was
make
saying
call
it was
PD
pretty
because,
awesome.
yeah, but I take patient privacy and patient safety very seriously.
Definitely something important.
When somebody has a gun out in my hospital, I'm gonna have issues. I don't care if it's for quote unquote for their safety. You're in a hospital. You are now the risk.
You're safe in a hospital. Like, anyway, I'm gonna go cook some food. I will speak to you guys soon.
It's nice to meet you.
Nice meeting you.
I'm still a resident doctor, even though I'm a senior doctor. 'Cause the thing
Right.
is still
Sorry
not
to bug you
fixed.
guys. Thank you.
Thank you very much. Have a great night. Get some good rest, miss.
I don't think anyone's told IT to change anything.
Alright, still me. I'm tired. You're sleepy.
Where's Kia so I can yell at her that I'm stealing her doctor?
I think she with the patient. She's with the patient, unfortunately.
Kia,
Do
I'm
not
stealing
yell
your
at her.
doctor.
Well, don't yell at her when she's with the patient. That's rude.
Wait, I didn't. Oh god.
Yoink. Ah! What just happened?
That looks great from coming out of the elevator.
What just? What? I try again. Expert avoiding beaver bush tactic. Nope. Okay, if I avoid it slightly less. There we go. Much better. And you still have your torso. Good night. I love you.
Night chat. Love you guys. Hope you guys have a beautiful night. Mwah. Yeah. Because it says my connection's good. So let's see if the stream restart helps.